So, Karen, if you want to read out the summons there.
Okay, thank you, Chair. Members, you are hereby summoned to attend the virtual meeting of the Health and Community Committee on Thursday, the 13th of May 2021 at 4 p.m. So we'll commence with the attendance. So Alderman Devaney. Alderman Guy.
Here.
Alderman Wark.
Here, Karen.
Councillor Barr. Just noted your attendance in the chat box there. Councillor Burke.
Shaw.
Councillor Duffy. Councillor Edwards.
Here, Karen.
Councillor Farrell.
Here.
Councillor Ferguson.
Karen.
Councillor Harkin.
Here.
Councillor Logue.
And Shaw, Karen.
Councillor McHugh.
Shaw, Karen.
Councillor Minnie.
Karen.
And Councillor Riley.
Here, Karen.
Thank you. So can I just confirm Alderman Devaney? And Councillor Duffy.
Karen Morris is on there. He's just having a problem getting through. It's the signal or something, but he's on there.
Thank you.
Karen, Councillor Duffy, Billet.
Just unmute, Chair.
I will now read out the statement for remote meetings. I would like to remind everyone who's in remote attendance that this meeting will be broadcast live via the Council's YouTube channel and will be available for viewing by the public and media. The broadcast will also be available for repeated viewing at a later date. This broadcast may be determined or suspended in accordance with Council protocol. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. By participating in this meeting, you are consenting to being filmed and to the use and storage of those images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. A copy of the Council privacy notice may be found on the Council website. So members, welcome to my last meeting as Chair of Health and Community Committee. First of all, I'm going to ask your, if it's okay with everyone, if I bring forward the deputation by the Western Health and Social Care Trust forward on the business, and then after that we will do chairperson's business and matters arising. So if everyone's okay for that, I'm going to ask for all the directors to come forward, and I'd like to welcome Theresa Malloy, Director Rebuild Plans. Oh, sorry, Director of Performance and Service Improvement. Bob Brown, Director of Primary Care and Older People Services. Tom Cassidy, Acting Director of Women and Children's Services. Karen O'Brien, Director of Adult Mental Health and Disability Services. Neil McGuckin, Director of Finance and Contracting. Dr. Catherine McDonnell, Medical Director. Chris Curran, Communications and Public Affairs Manager. And Oliver Kelly, Head of Communications. So I don't know who's going to take the presentation first, but I will let you take that away.
Okay, Chairman, thank you. My name is Neil Guckian, Director of Finance and Contracting. I'm going to start off the presentation and explain my role in all this, not just as Director of Finance and Contracting, but as Chair of Trust Silver, which is the COVID response. So basically, the agenda for today's meeting is set out on a slide there. I think somebody else has control of the slides. I think the next slide really shows the different presentations that we're going to be having. First and foremost, we'll be doing a presentation and update on COVID-19. Then will be Teresa will be presenting on the rebuild of services. We're moving on to Catherine McDonald, who will talk about the staff health and wellbeing and supports available, which is clearly a big issue for us coming out of the COVID pandemic. Unfortunately, Geraldine Mackay is unable to join us this afternoon. She was going to give a hospital and acute services update, and any questions we have on that we can pick up maybe and come back to council by written response if that's reasonable. And then we have Bob will then present on the community services update. Karen will update on particularly on adult mental health and disability services. Tom will present on women and children's services. And Teresa will finish off with a vaccination program update, which clearly is a significant element of the current way forward. Chairman, I would propose just to very briefly give an update on COVID.
Hello?
Can you hear me okay?
Yes, sorry, could I just come in there, Neil? Somebody,
No,
can
I was
everyone
just
turn
wanting
off
to
their
touch
mics
base
there?
about that licensing issue in Newton. You know, is there anything I need to know? Or...
Councillor McKee? Thank you. Neil, just before you go on there, this presentation, I know that you are stuck for time and so on. This presentation probably will last for around 30 minutes or so, and then there'll be questions and answers after. If members would like, they can put their questions into the chat box, because we may not get all the questions covered, but I'm sure the directors will be happy enough to put any questions in the chat box, that if they run out of time, then they would agree to reply to all questions by members collectively. Would that be okay, Neil?
Yeah, that's fine.
Yep.
No, we're
Yeah,
happy to hear that.
yep.
No bother at all.
So if you want to go ahead,
Chair, just before you move on, can I just ensure that you can hear me?
yes,
That's
Maurice,
okay. I couldn't get on the last time. That's thanks, Chair.
you're on there. Yep, go. That's grand. Go ahead there, Neil.
Okay, I was supposed to make a very solemn start to the presentation, and hopefully we can move on from this, but a very solemn start in terms of the COVID-19 position. You will see there that we have had 218 deaths to COVID in our acute hospital services. However, the last death recorded by the Western Trust in our acute hospitals was on the 21st of April. So I suppose that's the ultimate measure of progress against the COVID-19 pandemic. You know, in fact, if we haven't had a death since the 21st of April in our acute hospital services as sites. Obviously that's a very negative and solemn way to start the meeting. It's clearly, those are not numbers, Chair. These are members of our community and families who have been bereaved over the last year. And we analyze this every day in COVID, and we start off with just pausing and recognizing the deaths that have happened. It's clearly a very difficult time for our local community. The next point we'd like to make in terms of COVID-19 is the fact that the regional Nightingale Hospital has closed now as a result of the downturn in relation to the COVID pandemic. The staff have transferred back to the Western Trust, those staff who are working in that. So we're now moving towards business as usual. In terms of COVID impact on our hospitals, as of today, and the slide's a little bit different, but in terms of Gavin, we actually have 7 COVID positive patients and 4 in Southwest Acute, 1 in each ICU. Obviously, we need to maintain full COVID pathways, both COVID and non-COVID, and that is actually the current challenge for ourselves. We can't clearly mix positive patients with negative patients. The infection rates in the community in the Northwest continue to be a concern. There were 28 positive cases yesterday against 21 the previous day, and that's a trend going in the wrong direction for us. But and that's primarily, well, a major element of those are the younger population, we're informed. A more positive message is the outbreaks in nursing and residential homes in the independent sector. At one stage, it's hard to see from the graph there, but at one stage, it's my understanding we had 30 30 outbreaks within the Western area in our nursing and residential homes in the independent sector. And very quickly that went down to 0 after the vaccination program started. So that's a clear indication that the vaccination program worked for that category of resident. And finally, our staff absence has settled. In terms of Galvin in recent days, a total across all categories of absence was at 5%, which is the lowest it's been since the start of the pandemic. Albeit we recognise that our staff, in many cases, are tired, and some cases have been left adversely affected by the pandemic and by the major issues that they've been facing. But Kathleen will come back to that later in the presentation. So I just thought I would start, Chair, with some figures on the COVID-19 pandemic, because it's obviously at the front of all our minds at this stage. I'll pass over to Teresa now in terms of the rebuild plan.
Thank you. Next slide, please. Thank you, Neil. So I'll just give a very brief summary, everyone. My name is Teresa Malloy, of the focus on the rebuild plan, but this will be referred to by other directors as we move through the presentation. So normally within public organisations, we have an annual plan and are held to account for its delivery. But as you will probably know, that in June last year, and coming out of the first wave of the pandemic, there was agreement within health and social care that we needed to take a staged approach to recovery. And really since June, we have been working in all 3-month planning periods right through since then. And we are now entering what we call phase 5 of rebuild. So that's the 5th planning period that we're now in, and that's April to June of this year. We have obviously very significant regional context as we've worked very closely as a system coming through the pandemic, and that's very clear in our hospital services, but right across our services, mental health and community as well, and children's services. But there are 5 principles that have been agreed by our minister and by all of us as delivery organisations that we're working through and to in our rebuild plans. And Neil has already referred to one of those, which is the importance of the de-escalation of the regional Nightingale facilities at the Belfast City Hospital. And thankfully, we're now in a position where that has happened, and all trusts who've been contributing to the Nightingale now have been able to return those trust staff to normal duties, and the Nightingale facility has been de-escalated to normal. The other principles that we're working to as trusts is that we individually are able to de-escalate our intensive care units. And unfortunately, Geraldine can't be with us today, but to speak about the hospital position generally. But I can confirm that while we still have COVID patients in our ICUs, and Neil has referred to those numbers, we have been able to de-escalate our ICUs back from the surge position, which was a significantly higher number of beds required of our ICUs in Galvin and SWA, and we're now back to what we would deem to be normal levels of capacity. The second principle regionally is that we afford staff to take their leave before they return to what's we're trying to term normal duties. And Catherine will talk more about the supports that we're providing to our staff, but there is a very important recognition of the need for our staff to take rest in this period. The third principle is that we would work as a system in how we rebuild elective care. Again, we will not say too much about this today in Geraldine's absence, but just to say that there is now a regional prioritisation process which is operating at a regional level with our clinical and senior service people involved, which looks at the people who need care, most urgent care, particularly our cancer patients and those who are of highest clinical need, and that we work as a system across the region to prioritise those patients. And then the fourth principle is that we would develop green pathways so that we start to get our elective surgical services up and running as quickly as possible and remain as flexible as possible. So those are the 5 principles that we're being asked to work to as a region. In terms of our challenges, they are very many, and they are across all of our services, and you'll hear more about that from directors. But just to outline the various streams of work that we're having to balance, we are continuing to maintain services in a state of COVID readiness. And that's not just our hospital services, but services across our community as well. We are stepping into and have stepped into since June last year the rebuild of our plant services. And again, not just our hospital services, but right across all of our services. We are planning and expecting that staff will need to take rest, and we have to factor that into our levels of capacity. And then finally, we are seeing a growth in the level of demand through our unscheduled pathways, and we're having to manage that in conjunction with all those other demands. In terms of services rebuild, we have quite a slick process going now. If members want to look at our rebuild plans, those 3 monthly plans that we produce, you will see them on the department's website, and you'll see the phase 5 plan, which is the period that we're in the department's website and on our own website. Those are public documents, and you have a very thorough narrative description of the work that we are doing to rebuild, and also data of the volumes of activity that we expect to be able to step through in the coming months. And Chair, I'll just draw this slide to a close now, because I'll hand over to service directors to talk about those areas of service and the detail of that service rebuild. Thank you. If we can move the slide on, please.
Thanks very much, Teresa. Before we go in specifically to services, I just wanted, I'm Catherine McDonald, I'm the Medical Director here in the Western Trust, and I just wanted to speak a little bit about our attention to our staff as we go forward. In terms of implementing our rebuild plans, it's critical that we've got a healthy and well workforce. So it was just to bring to your attention some of the activity that's going on within the Trust and our thinking around how we're going to keep and support our staff after what's been the most challenging of a year to 16 months. As you can imagine, our staff are like all citizens within the community. They've suffered the challenges of both lockdown and the consequences of COVID as a disease itself, but they've also had particular risks and particular stressors in relation to how they've been required to carry their professional lives in terms of both the risk to their health and to their families, in terms of how we've asked them to work in very many different ways, and in terms of the challenges of going forward in terms of trying to rebuild and bring back some normalisation to services. So there are 3 umbrellas under which we think about this. I'm just going to take you quickly through the 3 of them, knowing that time is short. The first is what we describe as COVID safety, and it's really looking at what we do to keep our environments and our facilities COVID free, which is critical to keeping our staff well, also keeping our patients well, and making sure that we've got capacity within our facilities to deliver services to patients and to their families. The second is psychological support, because as you can imagine, this has been a particularly challenging time for staff in terms of the environments and the circumstances in which we've asked them to work. And the third is just our general commitment to staff health and well-being. So I start just with staff safety, and what I describe are the 4 essential building blocks to ensuring that we have a COVID-safe environment, and what we need to do within the Trust. And the first is testing, and just to say we continue to increase our testing capacity, both in terms of testing staff who may be symptomatic and carry COVID symptoms, and in terms of testing patients as they come through our doors, and that footfall thankfully is increasing. We have our contact tracing system, which is really important that it responds quickly to any positive staff member in terms of us doing the contact tracing, and to ensure that we don't have outbreaks and spread of COVID. The third is our PPE supply, which, as you can imagine, compared to the PPE we were using 16 months ago, has turned into a vast and massive task in terms of ensuring that we've got quantities and quality of PPE that keep our staff safe. And that is something that we pay particular attention to. And the fourth is our vaccination programme, in terms of ensuring that our staff have easy access to vaccinations. So those are 4 critical services. They're relatively new services, and expanded service over the last 16 months. So we work hard on that. The second area that we've looked at is, as I say, looking at the psychological support that we did. The second area that we look at in terms of COVID safety is a particular group that was set up called Working Safely Through COVID. And this was really developing a network of safety leads across the organisation and both our community and acute facilities, where we support the staff to learn how to maintain these facilities, to keep themselves safe and to keep the patients and clients safe. They're supported, they can't do this on their own, so they're supported by an educational programme which is delivered to what's called an ECHO platform. We're up to between 70 to 100 staff met on a weekly basis to just really skill themselves up and have the support and learning from both experts and from each other as to how to do this and how to do this well. Alongside that, we ensured that they had easy access to the best evidence and guidelines. We all looked at how do we do risk assessments and risk management of facilities and areas across the organisation. Some of things like trying to ensure that they had facilities to have a break, and that became very difficult because our environments weren't designed to absorb social distancing very easily. So lots of changes to make to the environment, lots of changes to make to how people actually manage themselves in terms of wearing face masks, in terms of environmental cleanliness. So lots of changes for staff. And the fourth support that we had for them was a system to allow us to listen to staff and to hear what was going well and how they needed additional support. And we often say that they are the eyes and ears, our staff, and it's extremely important that we can access that frontline intelligence easily and effortlessly, and that has worked well. So the second umbrella is really the psychological support, and that has been led by our psychologists, who've really developed a bespoke programme to support our staff, both as individuals and teams. And they have carried this out for areas that have had critical challenges, such as our ICU staff, our respiratory staff, etc. As you can imagine, our staff were challenged by looking after patients in a different way, wearing PPE, not delivering compassionate care in the way they normally would. And in terms of supporting people, particularly at the end of life, with the added difficulty of families not being able to be there and because of the restrictions of visiting. So we've also, in addition to the face-to-face sessions and by virtual consultations that we've delivered, there's also webinars available for individuals and for managers to support their teams. And our third area is our commitment to health and wellbeing and the broader aspects of this, which are delivered through what is known as our Twist to West programme. This is an intranet site which includes a wide range of resources and supports the health and wellbeing of all. It includes a breadth of information on finance, parenting, diet, mindfulness, and it promotes classes and sessions within the trust and also within the community. The Twist West team in particular has also responded to specific needs within our more vulnerable groups, which includes our ethnically diverse staff and those who've suffered long COVID. So all these activities will be continuing into the future as the challenges and uncertainty continue for our dedicated and committed workforce and to support them and continue to deliver care and services to our communities. So thank you, and I will hand over now to Dr. Bob Brown, who will give you an update on community services.
Catherine, and I hope everybody can hear me okay. And just ask for the next slide, please. And one more slide. Thank you. So my role covers community services, and I'm the nursing executive director, and I want to just refer today to those areas that you see referenced in the care homes and in our home care or domiciliary care service pathways. Also then to say a little bit more about some of the community specific rebuild initiatives that link with the hospital, and finally on visiting. So just to say, with regard to care homes, as Neil was saying at the start of the meeting, we've had a very successful vaccine programme. 95+% of residents are vaccinated across the Western area. And I think that's probably at least a national exemplar and even beyond in terms of the uptake. So that's tremendous. And we very much look forward to a likelihood of a boost programme in the autumn and winter. And that will, we trust, provide that additional protection from COVID, and combined, of course, with the flu vaccine. And our outbreaks were at zero until we have had an outbreak in recent days in one care home in the Western Trust area. But there are now only 5 in total across Northern Ireland, and so the overall position is excellent. And of course, transmission is still in the community. The risks are fluctuating, and we must always maintain the COVID secure practice that I'll refer to in a short time. The care home support team, who are absolutely crucial throughout the first year of COVID, continue to provide advice, support, and direct rapid response input to care homes. It's a small team, and we intend to build that team in the time ahead, but their expertise has been really well valued, and we continue to meet on a fortnightly basis with the independent sector, the private care home providers, and we support them with a whole range of work, which includes the visiting programme that I'll come to at the end. The work to really develop the domiciliary care programme back to its full potential has continued for a number of months now, and I can say that we've reset or re-established domiciliary care activity to around 90 to 97% of pre-COVID activity. Now, there are currently, or at the end of March, there was just over 3,500 domiciliary or home care service users in the Western Trust area. And that's around about 500 down from pre-COVID. And that reflects reduction in referrals overall, because, for example, more families have been taking on care themselves to reduce the number of people who would come across their front door during the COVID year. And there's other reductions in overall activity, as well as, and it's quite positive, an increase in direct payments. So families who have a greater choice, personalisation of care, and the ability to take on ways of providing home care under their control as such. So that's one of the reasons why our overall numbers are down, but there's still 38,000 hours of domiciliary home care in the Western Trust per week, or 74,000 contacts. And in terms of unmet need, and there are always, unfortunately, some people who are waiting for either their whole package of care or some of their package of care. That currently sits at 127 clients, just over 1,000 hours that we're every day pursuing. But that is a factor that we always prioritise and look for ways of being able to put those full packages, as assessed, in place. With regard to the home care workforce, we had a highest absence due to the COVID situation of over 100 people off sick in October, and that's come right down, as we would all have hoped, to a very small number now. And I'm pleased to also say that the latest report indicates that over 70% of home care staff have had their COVID vaccine. So it's altogether a positive picture, and one which we will continue to watch closely in our key community services. To say a little bit about rebuild pathways, the examples that Teresa referred to, and we could spend a considerable amount of time on, but overall I'll just offer a couple of examples. So while Sterling can't be here today to talk about acute services, we work very closely in terms of how we will rebuild and establish new ways of working across the hospital and community interface. And whilst in the emergency department, which is currently under significant pressure, we're adopting new schemes such as Phone First. We're also very focused on a priority around improving ambulatory pathways through the hospital and into the community. And that's closely connected with our frailty model. So our ambition is to ensure that if a person must attend a hospital, they can do so for the shortest amount of time. Thus, the ambulatory model, where, for example, they can come in, have a rapid assessment, perhaps be referred to what we call a rapid assessment clinic, and then be picked up back in the community through a short admission, if at all, admissions needed. And in the knowledge that a significant number of people have more than one condition, we hope to be able to defer attendance from an emergency department working closely with the ambulance service, but also turn them around back into the community more quickly. So that combination of a multidisciplinary team impact, working with the ambulance service, liaising with the care homes in terms of enhanced model, is the main community rebuild initiative of the next 12 months, working under the overall context of the regional No More Silos piece. And I would just like to finish by saying a little bit about visiting. So within hospitals and indeed within care homes, the Minister has published the revised guidance last Friday for all settings. And we worked very closely with all the teams to put in place the new guidance. And it's a significant situational change in that prior to last Friday, a person in a hospital would only have had one visitor once per week for 1 hour. So we've moved to one visitor for an hour every day. And you can imagine that increases the footfall quite significantly into the hospital. Also with that brings some risks, and our priority is to manage that safely, whilst also being absolutely clear that we want patients to have a visitor as part of their overall well-being and ideally part of their recovery. So being able to do that in a COVID secure way, and always working with the 5 key principles: 2 meter social distancing, optimizing hand hygiene, good ventilation, appropriate use of personal protective equipment, and always wearing a face covering. We have been able to facilitate the visiting in our hospitals very well. There have been several areas of particular challenge, such as maternity, that we're working very closely to continue review, and the visiting guidance is subject to within the trust review every week, if not every day, and regionally on a 4-weekly basis. And then just to touch on care homes, we have also worked within our local 5 residential homes, all of which are in the northern part of the trust, to facilitate visiting, which is now moved, we're very pleased to say, to a resident in a care home can have 2 visitors twice per week for a minimum of an hour. A maximum of an hour, I should say. And also then it's really great to be able to note that a resident of a care home under an appropriate risk assessment should now be able to go with their family member for a drive or a visit to an out-of-the-home facility, always on a one-to-one assessment basis, part of their care plan, and it's part of what we call that dynamic risk assessment process. And these are the first steps in resetting visits for care homes residents, which is absolutely crucial. And we look forward to, if all goes well this summer, both within the care homes and within our hospitals, increasing that step by step with a 4-weekly review. So thank you very much. Over to Karen.
Hello everyone, I'm Karen O'Brien and I'm the Director of Mental Health and Disability. So if we could move the next slide on, thank you. I suppose most people would be aware that throughout COVID, we had a number of people who normally would have referred to our services in mental health, those numbers being reduced, and we've seen COVID as a barrier to people seeking timely help. And saying that, that result was 29% reduction in the overall referrals into our service, which for us was really worrying, because after our services closed in the early stages of the virus, we opened them very quickly and kept them open. Unfortunately, a lot of people did not avail of the services, and as a result, we are noticing the overcapacity in our hospitals at this point in time, where we have a lot of people who are very sick at this stage. And it is not surprising that we are noticing an increase now in referrals into our mental health service. Our waiting lists are growing, especially in our psychological therapy services, and we're also noticing a consistent increase in admissions to our hospitals. And I suppose from our point of view, it's very much looking at from last year how we maintained the services and also adapted our services to deliver differently. And that would have included some virtual services, especially with regards to our personality disorder service or our mental health liaison service. Anything that we could do differently, we did. We also looked at our day centres, and because of COVID and social distancing, we adapted new ways of working, which resulted in reaching into families' homes and reaching into carers' homes so that we could give carers a break. Because recognising that to not have our day centres open and to not have our service users in the day centres, we were putting a lot of pressure on our carers. So from July last year, we've worked really hard to get us to a position where we are nearly at full capacity. So over the next number of weeks, we're hoping to move further to having all our services open, and that includes our day centres. Where we can have social distancing and where the restrictions apply, we will appropriately amend and make sure that our service users and our carers are getting access to the services that we need. And I suppose collaboratively together, it's looking at how we develop and do things differently to meet the needs of the population when it comes to the increasing need for our mental health services. And I do know we were invited to yourselves on Monday evening, and we did give a presentation on our addiction services and what we had to offer with regards to drugs and alcohol. So I'm sure you're very well aware of what's going on around that area. So really, that's me at this point in time.
Can we move to the next slide, please? Tom, are you able to come in?
Yeah. Hello. I hope you can hear me, but my name is Tom Cassidy, as it says on the slide. I'm the Acting Director of Women and Children's Services. And really, I just want to sort of come on the back of what everybody said in relation to the difficulties we already had with COVID and some of the challenges that we've had. So I'll not repeat them. Just in relation to the Women and Children's Services, I'll just give you a sort of very brief overview of what that means. We have some services that is based within the acute sector, pediatrics, obstetrics, and gynecology, maternity. All the sort of social work services you would think with in relation to children who are looked after in the care system, children, child protection, family support, would all be within the directorate. We have got public health, which is health visitors and school nurses, and we've got CAMS and children's disability. So that's a sort of broad spectrum of what the Women and Children's Directorate does. There's some other things like early years, but that's a very broad spectrum of it. Just relates to the rebuild services. I mean, I think one of the things I would like to say, and I actually want to say it to commend the staff, is that the vast majority of our services we kept going throughout the pandemic. And for instance, in relation to CAMS, we delivered a number of new appointments. I think 960. We've continued to work with our child protection, visiting families, making assessments, we work with our looked after children. A number of children have come into the care system during the pandemic. That meant that our social workers going out and visiting, and obviously after assessments with proper PPE and COVID. We've worked with our foster carers in the sense of visiting, reassuring people, because a lot of families maybe didn't want people coming across their doors, so we had to work with them. Again, in relation to some of the other directors, we've worked sort of differently. We've worked virtually. We've had different types of engagement, as I said, on different digital platforms. One of the things I have noticed is that there is digital poverty. A lot of our young people and families didn't have access to digital stuff. And we had to work with them closely in order to do that, provide certain processes. A lot of our young people, in relation to phones, didn't have the money to update them, didn't have the money to, keep credit on their phone. So we had to work with them in relation to that. So there was a lot of engagement with our service users to try and have, appropriate facilities. So we've kept a lot of our services going. And again, in relation to rebuild, I think we're going to again continue to work with our service users to see what's the best processes in order to do it. And I think again, hopefully the vaccine will continue to work, and the whole COVID environment will become a lot less acute. So Well, I think a lot of things that we've learned is that sometimes the virtual platforms actually work. They work for a lot of young people who are used to it. Maybe not the likes of me, for instance, like an old Neanderthal, but a lot of our young people are very much au fait with digital platforms and digital communication, and really appreciate it, and we can engage with them in relation to that. So we continue to do that and rebuild our services. But again, I just want to emphasize a lot of the staff have continued to work. Like in residential childcare, we've had to continue to work and 24/7, and a lot of our young people who were within the residential childcare world didn't adhere to the COVID guidance. A lot of them might be out and doing things, but again, staff worked diligently to work with them, encourage them, and again, a lot of staff were coming into work even though they were concerned about their families at home. So I really have to pay tribute to them. And again, just the second point is I mean, I do think we're finding, I think Karen just previously, that we're finding a lot of more mental health referrals in relation to CAMHS. We've had increased referrals, and certainly one of the things that we have noticed that increased referrals in relation to very ill, psychiatrically ill young people. And I mean, the regional facility, which is called Beechcroft, which is in Belfast, at the moment we have 6 young people in there, and that's been unheard of. That's a number that we've never heard of previously. We have that facility is full at the moment, so there's all sorts of issues about maintaining young people's mental health and getting them the appropriate services. And I just think in relation to children's, young people, emotional health and well-being, young people throughout the scope of the Women and Children's Directorate, I think we're sort of holding our breath. We're not sure exactly what that will mean, but I think all the indicators are pointing to an increase in referrals, and that when as I said before, when the acute end of the COVID hopefully begins to diminish, I think you will see a lot of people coming forward with referrals in relation to people's emotional health and well-being. So really, sorry, that was just a quick overview, but again, it comes in the background of what people said. So I mean, hopefully you found that very helpful or helpful. I'll finish there, Teresa.
Thanks very much. And just the last part of the formal presentation is a short update on the vaccination programme for Council. You can move to the next slide, please. Thank you. So I'm sure you're aware from the publicity that within Northern Ireland, we're at almost 1 million people having received a first dose of a COVID vaccine, and almost 500,000 people having received their second dose. And we're all familiar now with the delivery approach that the Department of Health have adopted to deliver the vaccination programme for Northern Ireland. The mass vaccination centres have been run by trusts since December, and we also operated mobile teams for a period where we did vaccinate people in care homes and supported living and day centres, and also the homeless. And largely that work has been stood down now, but we're maintaining the mass vaccination centres and that programme of delivery. I'll go on to why that's so important in the coming months. But the department have also, of course, set up the SSE, which was to be the very significant high volume vaccination centre for Northern Ireland. GPs have been continuing to vaccinate, and they're mostly vaccinating with second doses for their patients, their older patients at the moment. And also, of course, there are over 360 community pharmacies across Northern Ireland who are now delivering vaccination as well. As at last week, we were at 133,000. I can confirm we're at 144,000 vaccine doses now delivered in our mass vaccination centres and mobile teams by the Western Trust vaccination programme. Mostly those are Pfizer vaccines, but we did for a period vaccinate with AstraZeneca in our 3 centres, and in fact that second dose vaccination will come around after the normal dose interval towards the end of this month too. So we'll be doing second dose vaccines with AZ as well. We have direction now from the department and slots released. It had been up to the 9th of May, but we now have slots and had slots released up until the 23rd of May. And obviously, we are working to a 10-week dose interval. So 10 weeks after those vaccinations, first doses are delivered, we then have booked in people to receive their second dose. All first doses are now Pfizer within our mass vaccination centres, and it's likely that given the revised JCVI advice, which has come through, which is that those aged 30 to 39 should be offered Pfizer as their vaccination, it is likely that the vaccination centres now will be operating certainly to the end of August and potentially into September. And I suppose at this point, Chair, I would just want to acknowledge and thank the Council, Derry City and Strabane, of course, but also for Mananoma District Council for the very important partnership arrangements that have been in place in the operation of the centres. We have been using your leisure facilities and your support to plan that and deliver it. And certainly the feedback that we've been getting from those who visit those centres and receive their vaccination is that the service is very much welcomed, well received and well run, and we can only do that with your support and have been linking very closely with Karen McFarland, your officers, more generally on that issue. You'll know that JCVI and all of the delivery organisations operate to a staged approach, moving through categories, with most vulnerable really having the highest prioritisation in the early months of the programme. And now we're down to the age priorities, and at this point in time our department have released anyone over 30 to have their vaccination. There is limited slot availability in the mass vaccination centres generally, with the exception of the SSE, where there's still plenty of availability. And that's really because we've been, at this stage in the programme, having to deliver quite a lot of second dose vaccines. We open 7 days a week. We're doing about 1,200 doses every day, and we're very, very busy, given mostly second dose vaccine, but have had some availability for first dose vaccine, and that has been very quickly booked up. So our message to those that are still waiting for their second dose vaccine that are under 40 is that they should be patient, and that is being planned in, and we are releasing slots as soon as the Department of Health allows us to do so. There has been one other development, which is that we have been writing to those that are severely immunosuppressed. GPs and ourselves know who those people are, and they are now allowed to have their household close contacts vaccinated as a priority as well, either in community pharmacies in the SSE or indeed in our own vaccination centres, and there's a process around that at the moment. I suppose just finally, with yourselves as elected representatives, we are trying very clearly to get a message out that people should attend for their second dose, and they should work with us to attend in the slot that they've been given, because it's very difficult, as you can imagine, a very fast-paced environment to reschedule anything. And you know, we can do quite a lot online now, but actually it is very disruptive. So we're asking the public to work with us to attend for their second dose and to attend in the normal slot that they've been scheduled. Chair, that concludes the formal programme, and I believe we're going to move now to question and answers.
Thank you, Teresa. I thank all the directors for taking time out today in their busy schedule to come in and present to the committee here. That's very much appreciated by all the members. So now we'll take a few questions. Now, I'm going to allow 2 minutes for the questions, because we don't have a lot of time. It's just to let everybody get in. So I'm going to take a few, and then I'll come back to the directors in, and then you can do your best to answer them. So first of all, we have Councillor Barr.
Thank you, Chair, and thanks to everybody that took part in the presentation. I'd just like to touch on the issue of unpaid cares and working cares. And unpaid cares, most likely caring for a loved one who's possibly suffering from a severe physical injury, a debilitating illness, or an acquired brain injury, will be faced with responsibility for shopping, laundry, cleaning, cooking, running farms, managing money, etc. They're paid $67.70 cares allowance for performing these tasks. As anyone would expect, performing this duty can take its toll on the carer's own health and well-being. For instance, 54% of carers have said they've reduced the amount of time they exercise. 45% say it's hard to maintain a healthy, balanced diet. And 8 out of 10 say they feel more stressed. 7 out of 10 say caring has made them more anxious. Working carers are suffering the same negative impact on their health, trying to hold down a job and care for a loved one. At the start of the pandemic, the Minister for Finance advised that he was removing carers of vulnerable people from the Labour Relations Agency guidance for employers and employees during the present situation, while those on GB remained on the ACAS guidance. These working carers have the added worry of working and possibly bringing the virus back to those they cared for. Carers invariably have no social life, no sick leave, no holidays, and are under intolerable pressure. Is there anything being done to help these people who I feel are being morally blackmailed to work by proxy for the health service? Thank you.
Thank you for that, Sean. Next on the list is Councillor Farrell.
Thank you, Chair, and thanks everybody for coming. First of all, I'd like to just thank the entire team at the Western Trust for the professionalism and the dedication that they have shown in the face of the unprecedented challenges of COVID. As yesterday was International Nurses Day, I want to pay special tribute to our fearless, formidable and fantastic nurses. They go above and beyond every day of the year, and that's not just during COVID, to keep us all safe. I'd like to pay tribute to the outgoing Chief Executive of the Western Trust, Dr. Anne Kilgallen, for the leadership and the tenacity she has shown in the last 3 or 4 years. And it would be remiss of me not to congratulate Neil Gauguin on his appointment as the new Chief Executive of the Western Trust. Neil, you have big shoes to fill, and the SDLP wishes you all the best in your new role. This is Mental Health Awareness Week, and I want to touch on mental health waiting lists. The waiting list for children and adolescents has decreased by 52% in the last year. We have 145 children and young people waiting over 9 weeks to access the service. In terms of adult mental health, we have 194 people waiting over 9 weeks to access the service, and that is reduced by 61% in the last year. So both those figures are really positive. There may be underlying factors that have contributed to that. We're not meeting target, but the downward trend is really, really encouraging. Unfortunately, with psychological therapies, it's the opposite. The waiting list has increased by 46% in the last year, and one unfortunate individual is waiting over 2.5 years to access the service. So my question, I'm going to just ask the question now. So in terms of the waiting lists for psychological therapies, what are we doing to reduce that? And when can we expect the target of 13 weeks to be met? And one final question about pregnancy scans in Altnagelvin. It was understood that partners would be allowed to attend pregnancy scans from Friday last week, and I am under the impression, I've heard firsthand from somebody that at Altnagelvin that's not allowed. So I'd like some feedback on that, please. Thank you.
Thank you, Councillor Farrell. And next up we have Councillor Duffy.
Thank you, Chair, for allowing me in, and thank you to everybody for the presentation. And I suppose it's what the general public want to hear in terms of the rebuild plan and where we're at and how we ensure that our services get back up and running to normal levels. Like Councillor Farrell there, I want to congratulate everybody in the Trust over the course of the pandemic in terms of the commitment and dedication that they have shown and the tenacity as well. But I also want to congratulate you on the rollout of the vaccine programme, because you know, we have certainly never seen anything like it in our lifetime, and it has been a tremendous success for you. So I want to congratulate you on that. And like the previous speaker, congratulate Neil on your new post and send our warmest regards to Anne Kilgallen. She has been a great advocate anytime I've been in contact with her. In terms of the question there, Councillor Farrell has covered it in terms of the mental health stuff. I'll be a wee bit more specific. Karen, probably a question for yourself in terms of the therapeutic and psychological services. I do work as well in the homeless sector, and we have seen a massive increase, as Tom has outlined, in young people presenting with significant mental health issues. And I know you've moved on to adult psychological services, but I have a young person who has left CAMHS and is now on a 98-week waiting list for therapeutic services with the adult services. And not to touch on a specific case, but just in terms of how can we address that? How can we work together in terms of the trust and us as a council to highlight those issues, to ensure that resources are targeted where they need to be targeted at? And as Councillor Farrell has said, other waiting lists have gone down, but this specific waiting list does seem to be significant. So if there's something that we can do to work together on it, and then just, I mean, I was talking about visitors, and I am sorry to hear that we do have an outbreak in one of the care homes. We have been doing so well on that, but hopefully it's under control in terms of the people being vaccinated. The maternity appointments, it's not really in relation to scans. It was just the normal antenatal appointments that I was getting concerns from people about. The partners could attend the scans.
Councillor Duffy, should you put your remarks to close,
but
please?
other antenatal appointments they couldn't. And then just around surrogacy, I've had a query on surrogacy, and if the trust plans to bring in a surrogacy policy, because I know that there is somebody that is having specific issues with that at the minute. Thank you for your indulgence, Chair.
Thank you, Sandra. Next we have, I'll take one more and then we'll go. So it's Councillor Riley next.
Thanks very much, Chair, for bringing me in. And like others, congratulations. Good luck to you for all I suppose an interest, Chair, just as Alzheimer's Society and about and the issue. We know that those that have died in Northern Ireland.
Do you want me to turn off your video? You're breaking up there.
So about how can be or
Martin, yeah, that's okay. Yeah. Try again there.
In relation to dementia, thanks, Chair. I'm just asking Bob in relation to how they can plan for people living with dementia, because they've been very badly hit. As I said, 1 in 3 of the people that died in Northern Ireland with coronavirus also have dementia. Second question, just in relation to the ramifications of COVID. We all know this is a new pandemic. How is the Trust planning for long COVID in relation to those people who have had the virus and then subsequently may develop conditions, may have implications for their longer term health? And I think that there is an issue in relation to how in Northern Ireland that's been planned for in comparison to England and Wales. So any clarification the department can give on that would be appreciated. And the final question, Chair, is not for the Western Trust, I suppose. It's more so for us as a council. And linked to my second question, in terms of long COVID, how are we as a council looking after the welfare of our staff who have been diagnosed with COVID, who are either recovering from it, etc. Given it's a new illness, what's the council doing in conjunction with trade unions and others to try and see how we fit into our normal processing of staff who've been on sick leave? How do we factor this illness into all of our human resources plans for staff who are unwell and recovering from the illness? Thanks, Chair.
Thank you, Martin.
You're on mute, Chair.
I'll hand it over to the director there. She's wanting
Okay,
to come back.
maybe I'll just take a lead just by responding to the kind wishes, Chair, first. Thank you for those wishes. I will highlight that I won't take up post until the 1st of July. So I'm suitably looking forward to the role, but Alan Pagan is very much in charge in the meantime. So to reassure you on that. I would want to confirm that Bob has had to leave us for a short period because there's a 5 o'clock flow meeting in the hospital, which he will be joining from 5 to 20 past. So maybe I would ask Karen to answer some of the questions that have been addressed to her in the meantime, if that's okay, Karen, in terms of Councillor D's in relation to, well, certain, at least Councillor D's and indeed Rory Farrell's question as well. And Karen, could I pass over to you?
Sure, thank you. Thank you, Neil. Can I thank both of you just for raising the issues, because they really are important, and they're important to us, and one that we continue to work very hard. And as you've said, over the last year, albeit it was a really challenging year for us, we worked really hard to make sure that we reduced those waiting beyond 9 weeks for our mental health services. And again, we will continue to do that. But you would be aware of the new mental health strategy and the action plan that is attached to the strategy. And what that means for us is looking at a whole, I suppose, review of the regional services and the system in which we run our psychological therapies. And one that is very specific to yourselves is Action 11 of the mental health strategy, which is very much Action 11, Action 12, which is about embedding our psychological therapies into our mainstream services. And again, that is looking at making sure that the skills that we have, the multidisciplinary skills, are there to meet the needs of the individuals who are assessed for the right therapy. So sometimes when we just label it as psychological therapies, it just is a one size fits all, when what we must recognize is that we've got to target the therapy to the need of the individual. For us in the Western Trust, whilst we await the review of the region and the work that's ongoing on the back of the strategy, we have embarked on an improvement project to look at our own system and to look at how we can target our psychological therapy waiting list, and to make sure that we begin to target the therapy at the right need of the individual. And that is not just our psychological therapy service, but it's also looking at our primary care liaison team and our recovery teams to look at the skills within those teams to help us reduce those waiting times. It's an area that has been increasing. It is an area that most definitely causes us a lot of worry at this point in time, but one that we in the Western Trust are actively working on, and we are part of the regional review and the regional work on the mental health strategy and action plan. And I, as director, sit on those groups. And one of the areas that I'm very keen to see delivered differently is our psychological therapies. So at this point, I just ask for your patience and trying to find a way together of getting a better outcome for our service users and patients in this area. And I suppose, Neil, I could pick up a bit on carers too, because I do think our carers are extremely important to us. And I know Bob would equally verify this. We do within the Trust, in our mental health and our learning disability, at the core of the work and what we do is involving our carers, involving our service users and patients. And I suppose for us in learning disability, we have established what we call our local involvement groups, and we would encourage more and more of our service users and our carers to be part of those groups. COVID has been difficult for us and we've seen a bit of a setback, but we've re-established and more people are getting involved. And what that helps us to is begin to shape how we help our carers and understand their needs. And you're absolutely right, our carers have been invaluable during COVID. They have been there 24/7. They have also worked full-time and went back to home to care for their loved one. So in partnership with our carers, we've got to design what the future of our services look like. So for me, as the Director of Mental Health and Disability, I would welcome more of our carers sitting on the groups that we have established to help us look at the wider need and what we can do moving forward. Also with the department and the board as well, shaping how we support them in the future. Again, that's another journey we're on, and one that is really important to us, both myself and Bob, in delivering our community services.
In relation to Sandra's query on surrogacy, I think Teresa's prepared to say a few words on that.
Sorry, no, Sorry, Neil, I was going to comment on the long COVID question, if that's possible. I'm not aware of, I'm simply not aware of any issues around services and supportive surrogacy, but maybe Tom is.
Unfortunately, Teresa, I'm not.
Okay.
I can, I mean, I can come back to Sandra specifically. I'll find out exactly what the situation is and come back to you, Sandra, if you're happy with that. So apologies.
Yeah. Chair, I think we've agreed with Karen McFarland ahead of time that if there are questions that we're not able to take today, we'll take them away and we'll provide written answers. So we can certainly do it with that one. In terms of the question on long COVID, there is a regional work going on to look at a specification for an assessment service for long COVID. So the commissioning body, the Health and Social Care Board, is looking at that at the minute and is likely to commission services in the coming months, both regionally and from trusts in support of the assessment of long COVID. Can't say any more than that, Chair, but it is certainly recognising that there's a need for an assessment service here in Northern Ireland, and that has been the case, as you know, in England as well.
In relation,
Thank
Chair,
you.
to the visiting issue, but particularly around maternity, in fairness, Bob did raise that in his presentation. We are aware of councillors and members of the public's concerns in that area. We are re-looking at it, folks. We will try our best to do what we can in relation to this. Naturally, it's sometimes these issues are related to facilities and the challenges of delivering a service in a limited space, as much as actually the will of the people on the ground. We want to accommodate this as much as possible. It's all about keeping people safe, and we will try our best to accommodate people's wishes in that regard. But just ask us to bear with us. The new guidance only came out, I think, last Friday, so we're working our way through it. So bear with us in that one. But yeah, we do accept that maternity has been an issue over the last week. So it's just a matter of trying to work our way through the issues.
Bob would be the best person to code on that, but again, I just want to reiterate, because maternity is actually within my world, but Bob has been taken forward as the lead nurse, as the executive director of nursing. But really, just to re-emphasize, you know, the staff within maternity are absolutely totally aware of the need for the woman to be supported, and we're desperately trying to do our best. It's not something that we take lightly and trying to curtail some of the visiting. It's got to do with, as Neil quite rightly pointed out, some of the facilities we're not able to be COVID secure with the number of visitors. And again, and certainly some of the outpatients facilities, it's a similar issue where we have difficulty being COVID secure. And again, with it, we're balancing that up with trying to make sure that we don't that we allow people to come through and get the service that they're needed. But you're right, Neil. My understanding is that we're that it'll be a week tomorrow since the new visiting guidance was given by the minister, and we are going to look to review it and to take in all those considerations. But really, just to reassure you, in the sense that, you know, we're not taking these decisions lightly, and it's not done in any way to disadvantage people, because we absolutely know the need for people to be supported at this very, you know, emotional time for families and for women in particular. So it's really just to try and reassure you that that we are looking at it, and it's got to do with being COVID secure. But in Bob's absence, Neil, I just thought I might say that.
Thank you, John. Chair, in terms of Bob's absence, you know, we'll probably have to pick up the Alzheimer's query in relation to that, but if and when we're still here when he comes back. But I think is that all the questions? At least we've attempted to address them. Maybe we haven't addressed them.
I think that's
we've done our best.
No, that's fine. Sandra, I'm sure, is fine with you getting back there. Yeah, she seems okay. So I'll move on when all are set. Councillor O'Neill.
Thank you, Chair, and thanks for letting me on, as I'm not a member of this committee. and I've already declared an interest there in the chat that I am an employee of the Western Trust. So thanks for the presentations, and congratulations, Neil, on the new post as well. And just a thanks to all the directors for the ongoing engagement with unions throughout the pandemic, with the consultation group and the JNF. The first question is for Catherine McDonald, just on staff wellbeing. And I really welcome all the measures that have been put in place over the last year to support staff and their own wellbeing. And I have myself been actively involved in the Twist West Forum through my role as a union rep. But I feel many of these measures, you know, they're essential and they've been so welcome, but they also only address the symptoms of the massive pressures that staff have had to work through over the last year. Staff are exhausted. There's still an incredible amount of pressure on staff. Morale is really, really low, and burnout is rife. And there's still short staffing, and there's a massive pressure for beds as well. And you know, we've been inundated with this as unions with the stresses that staff have faced over the last year, and one of them, it feels like it's near impossible at times for staff to reduce hours through the flexible working policy because services and teams are so finely staffed. I feel we're at a really serious risk of losing staff who are our greatest resource. And so my question is kind of what systemic changes, you know, are we looking at or can be made to address the root causes of staff stress? I've just a quick another quick two questions, Chair, if that's okay, just to Bob. I know he's not here, and thanks, Teresa, for explaining about the measures for people living with long COVID, but also in terms of the rehab needs for the tidal wave of rehab need that is going to exist as the country recovers from the pandemic, with people's lives and stuff and support mechanisms being thrown upside down. Will there be an increased resource in that rehab for people living with long-term conditions and the general population? And then just with regards to on scheduled care, again, I know with the No More Silos projects that there's steps being taken to respond to the increasing demand on unscheduled care, as like our A&E department is stretched to the bone and staff are run ragged. But I'm wondering, is there engagement with GP services from the Trust, as many who are presenting to A&E would have been more appropriate to attend GP services, is what I'm hearing from the staff on the ground. And I know the phone first service exists, which is excellent, but despite the introduction of this, these demands still remain high. So just to find out a little bit more about that. That's me, Chair. Thank you.
Okay, thank you, Councillor O'Neill. Alderman Devaney.
Thank you, Chair, for allowing me in. And first of all, I want to congratulate Neil on his new position. And I want to thank everyone for coming here today with a presentation. And, you know, they've done a really good job in the last year. And some of the issues have moved on. But number one, I would just like to say well done on the vaccine rollout. It has been well documented that almost 1 million have their first vaccine, and 500,000 have their second one, which is excellent news. And I just want to touch base, and we all know the issue and around the Indian strain of the virus. How worried we should be and around that, and maybe a wee update on that. And I think the previous speaker has just touched on one of the issues that I was going to raise as well, and around the waiting lists. And we know there has to be a methodology in moving forward, and how we deal with the long waiting lists. But I just wanted to mention as well, as I read on Facebook from Altnagelvin, many nights we have notices on that the emergency is packed and they're under severe pressure. And I'm just wondering, is there any discussions going on? Is that because of lack of places maybe within the local GPs? But just to say some of the rest of the stuff around the care home visits, very, very welcome. And as I said before, I just want to pay tribute to all the staff and all frontline staff who have delivered a phenomenal service during the pandemic. Thanks, Chair.
Thank you, Morris. Councillor Ferguson.
Thank you, Chair, and thank you for everyone for coming today, and congratulations to Neil from us also. Again, it's brilliant to have you here. I know you are extremely busy, and I want to commend all the trust staff. They've been put under immense pressures recently and pre-COVID. So I am really pleased to see that staff health and wellbeing is being a key part of the rebuild programme. I just have a few questions, and I think it's one that's just been brought up. Back before the pandemic, he's presented to council that there was a program to try and minimise people waiting over 3 years for certain procedures. I know recently I've been in contact with someone who was referred in February, and when they rang up, it's a 2-year waiting list for that one procedure. So I wanted to kind of touch on, coming out of the pandemic, how are we going to tackle those long, years, people waiting many years for elective surgeries, and what kind of program are we going to see coming out of the pandemic? The other one, I know we've already touched on maternity services, and I know Bob's not here, but I've had someone come to me who said they've been quoted the COVID secure, and their question was around, if someone is presenting to assessment in labour, is their partner allowed to come with them? And particularly in SWA, I know that they have individual rooms in their maternity wards. Would this not allow for more flexible terms? And then finally, if you don't mind, we had a presentation where we were informed that, the long waiting list for CAMS, there was an issue with recruiting staff to the team, and I wanted to kind of get an update on where we were and how we were able to secure more staff for that amazing service that is really needed and has an extremely long waiting list. Thank you very much.
Councillor Ferguson, thank you for that. Councillor Harkin.
Thank you, Chair. And like everyone else, I would like to thank everyone who's come in and taken the time to present today. And it's very helpful and very useful to understand what we're doing. And again, like others, I want to thank everyone at the Western Trust that has got us through the last year and a half. It's not for nothing that we describe everyone at our health service as health heroes. And I can only imagine that work has become increasingly complex and difficult, and that's what it's going to be like moving forward. And we have obviously as a council discussed the needs of our health service many times over the last year. And I just want to give people a few examples of what we've discussed. I mean, we've passed motions here calling for ring fence support for the health service in terms of funding to be able to do what we need to do, because we want to build back, but we want to build back better, and deal with a lot of the kind of long-term issues that the health service has been facing. We've called for an end to privatisation of the health service. We've called for our care homes to be returned to public control and be brought back in to the health service. We've called for an end to waiting lists. And we've backed calls for safe staffing, which would be a huge issue to help with the many challenges that we face. And we've also backed the nurses and healthcare workers' call for a significant pay increase, which is very important in terms of morale going forward. And that's something I want to focus on and ask you a bit about. It's about the morale of our health service workers. Because I believe, look, our political establishment in Westminster and Stormont have got very good at congratulating people and clapping. But the reality is, nurses and health workers right now are being offered a disgraceful 1% pay increase that they've rejected. And unfortunately, they are preparing right now for strike action. I was at a meeting this week with hundreds of health workers talking about getting ready for ballot ready in order to prepare for strikes. And for a July 3rd day of action. So, the issue of morale, we talk about health heroes in terms of their contribution and sacrifices over the last year and a half. We talk about all these pressures that the Western Trust is facing, but the reality is, so the issue is, I would imagine how will strike preparations and this issue of morale actually begin to be impacting upon the build back plans, because at the center of those build back plans has to be the morale of our health workers. So I'm wondering, what's your thoughts on that? What can we do as a council to push forward and avoid avoid a strike, if that's at all possible? but this is where this is where we stand right now. Thank you, Chair.
Thank you, Councillor Hartman.
Sorry,
Anyone there now, Neil?
Okay, folks, a lot on that. Maybe I'll start off at the end with Sean's comments and link a few of the issues, because some of them does come down to resources. And I'm not trying to duck the issue, but Minister is on record as saying that waiting lists will only be resolved by significant recurrent resources for the health service. So we will be continually talking about long waiting lists until substantial resources are found by the executive for the waiting lists. A similar thing could be said about the pay. I would highlight, and again, it's not me ducking the issue, but the Western Trust does not set the pay for Agenda for Change staff, or indeed for any staff. These are on national terms and conditions, and we've fought long and hard to get to national terms and conditions. So this is a national argument, Sean, and we're really going to, I would encourage everyone to lobby as best you can to do whatever you can for extra resources for health and social care. And I would thank you for whatever motions you've passed over the last period supporting health and social care and the work that we've done. And it is appreciated. In terms of morale, we will continue to support staff as best we can. And Catherine has outlined a wide range of measures that we're going to do over the next period to support staff through what has been a very, very difficult time. I'll try my best to go through the different questions and assign them out to people. If we missed anything, Chair, obviously you'll highlight that at the end. But in terms of CAMS recruitment, Karen, do you want to? Oh, sorry, who can pick that up? In terms of which everybody's taking on visible tablets. Tom?
Sorry, in relation to CAMS recruitment?
Yes. And
well,
have we been able to recruit additional staff because of the waiting list?
Yeah, we have recruited some additional staff, yes. And again, part of the waiting list initiative was again using some different platforms and digital stuff. So we have been able to recruit some additional staff. And I would just commend. I mean, I've said it before, but I don't want to, go on about it. But some of the members have been talking about staff. I mean, staff have gone above and beyond. Not only in CAMS, but everywhere. It's been fantastic. But we have been able to recruit additional staff.
Okay, dead on. So then we'll maybe move on. The maternity issue in terms of someone in labour. It's my understanding we're working away on that, as Bob has already said, and that's been highlighted already. The waiting list in terms of pre-COVID for certain procedures have covered that will be a resource issue, and there is a gap between the demand for procedures and our ability and our resources to address that. The staff and wellbeing has been covered. In relation to other questions, then have we had discussions with GPs in relation to ED? The No More Silos project is a joint project with GPs, so we are engaging actively with private primary care in relation to trying to address unscheduled care. See what else we have. The methodology around waiting lists, again, it's a lot of us down to resources. The Indian strain, Catherine, do you want to pick that up briefly?
Yeah, just quickly to say that the update we've had is that there's very small numbers within the province, which we haven't got detail of, but there's been nothing to suggest that at the moment that it's spread to the west. So as I often say, sometimes this Glen chain pass is very useful in keeping things away from us. So far, we haven't been challenged with the Indian strain.
Okay, and I suppose while you're on, Catherine, the systemic changes to address stress is really around the issues you presented on, I suppose.
Well, it is, but Neil, it's a very good question because what I presented was what we're doing in terms of really supporting individuals. But as you're rightly pointing out, it's really the challenge of the system in which we're asking people to work at the moment, about which we have some control, and about which there are many constraints, as Anita's referred to. So things that that we can do, and that's what we try to do in the trust, to work with the things that we can do. So as Teresa has already said, when we were doing our rebuild plans, we were very mindful over the last few months about the need to factor in terms of expectations that all our staff needed to be getting their annual leave, they needed to be getting their rest time, they needed to be getting their breaks. So those are the sorts of things that we are very mindful of in all of what we move as we move forward. But what is it that we need to do alongside meeting all the unmet needs? And people are asking questions about all sorts of things here in terms of waiting lists, in terms of services for all groups of people, which are completely critical. But within that, we've got a constraint in terms of the workforce and the number of staff that we have. And we have to be realistic in terms of what we ask of people and in terms of expectations that we set for the public in terms of what we can do. The other thing I suppose that's really important to think about is that, and someone has already made reference to this, it's not about rebuilding back in the same way, that we're trying to be smarter about how we do things. We're trying to do things in a way that we will do differently so that we get as much as we can from the resource that we've got, but always remembering that our services are completely dependent on our workforce, and we have to think about them as individuals, but we also have to think about them in terms of the systems in which we're asking them to work. So we're really grateful for people's support in terms of really reinforcing that message at the moment, that we are dependent on the health and well-being of our staff and a reasonable ask of them to keep our services going. If the ask gets too big and our staff are crushed by it, we will have no service. So it's a really tricky balance at the moment, but we're grateful for all the support that people can give us with it.
Can I just add to that, Chair, in relation to, Maeve did ask about resources in relation to the staff and the challenges in staff. I can confirm that we have the resources to ensure that people get their annual leave. We have brought that forward, and it's a substantial aspect of it. But we have the resources linked to the cost of people taking their full annual leave, and we have been encouraging people to take their leave coming out of the surge. So hopefully that will help people. All it does is give people a little bit of a rest, but it's an important aspect in our recovery for our staff. In terms of rehab, Bob wasn't there to hear the question. My understanding of the question was around the rehab needs for the entire region for long COVID, particularly in long-term conditions. And will there be a concentration on that, Bob, into the future?
Yes, thank you for the question. And there's a very clear imperative to try to strike a balance between let's call it non-COVID rehab, where people are stepping back into the community from hospital into places like Waterside Hospital, but also trying to prevent their attendance in the first place, which I mentioned earlier. So there's a regional context around this that the minister's overseeing around the intermediate care strategy, and it also involves rehab into care homes. And we're learning all the time about long COVID rehab, which itself will provide a big challenge for health and social care going forward. And in the months ahead, we should be able to say more about that, but it's an equal priority.
Thank you. I think that's everything covered there, Neil, isn't it?
So it's most of my list, anyway. Everybody else, is everybody content with their, have we missed any questions?
And may I just give Councillor Farrell, I know you did mention visiting, but I just want to note that we have had a number of questions asked about visiting in maternity settings, and for COVID secure environmental risks, we have restricted visiting for partners of women who are pregnant to the dating scan, which is around 12 weeks, to the anomaly scan, which is around 19 weeks, and for any other medical assessment, fetal assessment as we call it. So it's still a very good opportunity for let's say fathers to be present. We are reviewing that, Rory, and we will be able to say a bit more next week. All of the visiting guidance is subject to regular review, as I mentioned.
At least Jerry didn't come back. He didn't contradict the rest of us. So while he was away, so that was a major achievement. So okay, thank you, Chair.
So I'll go on here to Councillor McHugh.
Thank you, Chair, and like the previous speakers, I too would like to thank the delegation for their presentation today, and also their work individually, and indeed the work of the staff under their stewardship right across the city and district. I know as elected representatives, we're often seen maybe to be critical of the Western Trust, but can take it that it's always and being constructive criticism in a way, and your work is very much appreciated, and we thank you for it. My question is just around, Bob touched on the visiting, the one person per 1 hour per day. Is that strictly the same person every day, or can it be a different individual each day? And is that the same right across all departments in hospitals, you know, from intensive care to lesser serious cases within the hospitals? Thank you, Chair.
Yeah, it's a helpful question because it's an area, Chair, requiring frequent clarification, but the guidance states that it should be 2 nominated visitors from a maximum of 2 households. And therefore, if I'm a patient in a medical ward in Altnagelvin, it could be, say, 2 family members who don't live in the same house, but that's the maximum, and they rotate the visit. And there are some variations, Rory, for example, in our cancer setting and in renal settings where there's a greater vulnerability for some patients, we assess that every day on the balance of risks, and we might only have 1 visitor named, and we may have no visitors depending on an individual's situation, the patient's situation. And then in palliative care, which either Foyle Hospice or in our palliative care unit in Oma, for example, we would have a greater number of visitors given the fact that it's an end-of-life facility. So always working on the basis of individual needs, working with the family and the risk assessment. Thank you.
Thank you, Bob. I'll take the final 3 questions and then I'll get you back in to answer them then again. So Councillor Mooney's next.
Yes, Chair, thank you for allowing me in, and thank you to Neil and the senior leadership team for coming today and addressing us and all the aspects of the COVID, coming out of COVID. I've really got 2 simple questions, and I'll be quick and straight to the point. Obviously, it's very frustrating for both the Trust and for patients that appointments have to be cancelled. And I note that the cancellation figures for January were like 806, in February 675. And I do suppose cancellations can be multifactorial, but I was just wondering, could anybody comment on if you have any strategies in place, or if you have any sort of policies to try and obviously reduce cancellations, and maybe comment on what effect COVID-19 had on cancellations throughout the Trust's departments. And one other follow-on, I've been contacted by a constituent. They ask, where could somebody actually go on the website or on the Trust's website to identify specific waiting lists for the various waiting lists and the Trust's remit? Somebody was saying it's very difficult to try and find them. Are they published weekly or monthly, or are they quarterly? But if somebody could maybe comment on that, and maybe even if somebody could send me a link if that was possible after the presentation. But that's my contribution. Thank you, Chair.
Thank you, Sean. Councillor Maguire. Councillor Maguire. No, I'll go on to Alderman Hussey then.
Thank you, Chair. And like others at the beginning, just thanks to Anne, and welcome to Neil. Thanks to all those who have made the presentations. And as others have said, thanks to every single person within the Trust staffing structure, be it cleaner through to consultant. Every single one an important element within the overall provision that we get. I suppose pre-COVID, we weren't in a good position anyway with regard to waiting lists, and COVID has increased the difficulties that we face within that, and it is resources that are going to solve that. And I mean, as has been pointed out, the Minister has pointed out the resource deficit. But, you know, it's not just the now that there's a resource deficit, it's historic. And therefore it has been cumulative. So it's a tremendous battle that faces us going ahead. You know, there's a political reality here as well, that some of us may have to think carefully about pet projects and highlight or prioritize health, because your health is your wealth and it impacts on every single thing that any elected representative tries to do. With regard to the period of COVID, I know that private health provision or private hospital provision was used as well. How useful was that during the period? It's mentioned there that trust care homes are changing, visitations, etc. You know, all of that sort of thing would change. Has that been replicated within the private care homes? And I'm mindful of care homes in my own EA on that. Teresa, I think, referred specifically to Galvin and SWA. Bob there just mentioned the use of, or the provision at Oma Enhanced Hospital. And, you know, just a wee bit more on how useful Oma Enhanced was during the, well, it's still ongoing, but with regard to COVID and plans for future development at Oma. And I'm particularly minded there of a phase 2 development, which I was told in 2018, specifically with regard to mental health and addiction. In 2018, I was told that phase 2 development was ready to go. The business case, I think, was on the verge of being approved, if not already approved within the department.
Alderman Hussey, can you finish through your comments there now, please?
Yeah, just a couple more things with specific regard to the point that I'm making there. Is the developing better services project team with regard to that, you know, phase 2 of Oma Enhanced Hospital still in position and still working towards that goal? And I suppose a very quick one to Tom with regard to staff. I realise that staff have been brought in, but I suspect that there's still a staff shortage. And are there plans in place to address this, provided the resources can be found to do that? Because people are the all-important element in this. Thank you, Chair.
Thank you, Alderman Hussey. Councillor Edwards.
Chair, hopefully you can hear me there.
Yeah,
Yep,
go ahead.
Thanks for letting me in, Chair, at the very end. Chair, I've been around long enough to, you know, I remember Transforming Your Care, the Bangor report, and the, you know, importance they put primary care on the future of health social care delivery across the north. But I'm just wondering, especially in the Strabane area, there seems to be, like, before COVID, there was a big issue with out of hours GP, and I know it's the responsibility of the Western Urgent Care, but for me as a rural representative, I get a lot of parents call me and message me, like other Derry reps. They're having to travel from very rural areas to Derry to help Galvin or to Oma. So I'm just wondering, as part of the rebuild plans, has primary care been sort of looked at, especially out of hours care, to try and bolster them services? Because our GPs are doing a great job. They have had to change the way they're working. They're also facing intolerable pressures in unprecedented times. But I'm just wondering, has primary care, especially GP services in rural areas, how does that fit into the rebuilding of health and social care after COVID? Thank you, Chair.
Thank you, Councillor Edwards. Councillor Logue, I apologise, I missed you. Are you ready to come in there?
and thank you very much. That's no problem, Chair. And first of all, thanks to everyone that came today to present to yourself. Just a couple of questions, some that you may not be able to answer today, but I would appreciate an answer for that after. I suppose the first thing I would like to say is, it's good to see that you have a well-being pathway for staff. I have a daughter who works in the of COVID going on, and I have been many very phone call from her, so on the importance of well-being. But given, we have had, I think we said 318 families bereaved by COVID in our trust district, and I was just wondering, is there any pathway for the immediate family members, given the trauma that they've been through, not being with their loved ones when they have died, and that, so I would appreciate services there for those people. As well as that, I would just have you sent any comparison figures for pre-COVID, regarding the diagnosis of serious illnesses such as cancer, etc. Say pre-COVID and now. And the other, just two other things will be very, very clear. Has there been any increase of those presenting to any amount of other services during the whole COVID pandemic? And I think the last thing is, it may be for Tom, I think it's to do with the vaginal mesh recommendations. Now, I do know it's the Belfast Trust that is dealing with that, and they have the centre there to deal with all those women, especially that have been impacted by this, negatively impacted by it. But has that service, been paused? And what are the waiting lists here? Would you know of the number of women waiting to be seen? They get surgery to rectify the issues that they're now suffering because of the vaginal mesh. Thank you.
Okay, thank you, Councillor Logue. Councillor Maguire, can you hear me there now? Councillor Maguire?
I think he's having technical issues, Chair.
Well, I'll go. I've just one question left, because obviously everybody else has had one before me there. But no doubt there's been a rise in admissions to mental health units throughout the pandemic, and no doubt this looks to rise and the rise set to continue. What is the expected length of stay by a patient in an acute mental health ward? How often do admissions require a longer stay? And are there any plans to open a step-down ward facility for patients who possibly require a longer period of stay whilst freeing up beds for new admissions? And that's my question. So I'll take it from there, Neil.
Okay, I'm going to ask Bob to answer. There's been questions about in relation to our interface with primary care and indeed private care home visiting, and indeed you'll touch upon OMA in terms of the contribution OMA's made to the pandemic. Karen will probably want to talk about the mental health business case, but I'll let Bob start off. And there's also a question regarding from Councillor Logue around bereavement support for family members. Bob will be able to hopefully pick that up. And indeed, I might as well get you to answer, Bob, in terms of the step-down beds and the process for step-down beds in relation to the chair's question as well, if that's possible, Bob.
Okay, I was thinking Karen will want to pick up that mental health question from the chair, but we'll come back to that together. With regard to Councillor Hussey, OMA's had a vital role through the last year, both in terms of rehabilitation, which is has the 20 rehab beds, and then the up to 10 palliative care beds, and the service model has been strong throughout, as well as the urgent care pathway. And you also asked about independent sector, the private care home visiting. It's part of the same guidance, Councillor Hussey, and we meet with the care home managers in the private sector every fortnight and are supporting them with their use of the visiting, and that's happening and in a phased way, as I mentioned. And for Councillor Edwards, with regard to GP out of hours, we work very closely with GP colleagues in a range of ways, and it's been mentioned earlier in terms of the No More Silos piece. The GP COVID centre here on the hospital grounds continues to be active, and that's a partnership, and we work with GP out of hours through that one part of that model, and given that you mentioned demands on urgent care and GP out of hours, we continue to look to ways of supporting them and having a multidisciplinary approach to some of that, and there has recently been some future direction suggested regarding how out of hours can be part of that overall 24/7 urgent care piece. And finally, GPs are leading the way, supported by us on primary care multidisciplinary teams, and right across the northern sector of the trust, that majority's work, that model's working well in the majority of places. And for Councillor Logue, finally from me, the one piece that's very clear in terms of well-being support after bereavement is in intensive care unit here in Alton-le-Galvin. We have a dedicated psychologist who's providing support to bereaved relatives as well as for staff, and we're pleased, Catherine and I, the medical director, to know that we're funding for a year for that role.
Thank you, Bob. Let me pass over to Karen in relation to the business case for mental health unit, particularly, and any other mental health.
Sure, Neil. The business case is one that we continue to update, and it is, I suppose, a unit that is going to be built. When it is going to be built, I suppose, is the question that we continue to have. It's not one that it said it's off the page, but for us, is that just to make sure we continue to keep the business case live, we continue to update it and submit it. So from our point of view, Alan Moore, who would work alongside ourselves, continually keeps this on the table. And I suppose from my point of view is that I would welcome if you continue to keep it on the table so that we can get this prioritised. And we ask every time we get the chance that this is prioritised. And we hope, both Bob and I hope to see this unit achieved before either of us retire at this stage, is what I can say. And maybe while I'm here, I can just answer the chair's question with regards to our mental health inpatient facilities and our average length of stay. What we would have noticed in 1920 is our average length of stay in days would have been 17.3 days. That's 2019, 2020. And in 2020-21, what we're seeing so far is 17.16 days. And I suppose from my point of view is that we would have had a step down facility, a very good step down facility in our OMA. And what we had to utilise that for to increase the beds because of our overcapacity was to register it as a hospital for extra beds, which results in our patients not lying in mattresses and not having to lie in chairs. What we are looking at as we move through to the future is a different facility that looks at slow stream rehab for our patients, and that is an area that we're exploring at the minute. But from our point of view, it is continually looking at how we can have a system that isn't just about inpatients, but that there's support for patients when they come out and that they can flourish in their communities and remain, I suppose, better longer, so that we reduce the number that are readmitted back into hospital. So we currently have what we call a bed coordinator. He's our systems coordinator that we've appointed, and he very much is looking at how we're utilising our beds, what is the beds like in our communities, including our supported living, but also looking at what is the biggest need so that we continue to keep people healthier and well and flourishing in their communities. I hope that answers your question.
In terms of
Thank
picking
you.
up some of the other questions, Chair, in relation to cancellation of outpatients, we are, Councillor Mooney, we are working away on on a virtual, we call it the VC 2020 project, which is really trying to maximize the amount of virtual clinics that we operate, and because of social distancing, but also really suits the geography of the West. So we are at the forefront of that in Northern Ireland. We are setting ourselves targets to implement that. Some of our council appointments were indeed due to the pandemic, both in terms of functioning and indeed from the population. So we have strategies in place to address that going forward. I maybe ask Teresa to pick up in relation to the website on waiting lists and where people can get waiting lists.
Yeah, thanks, Neil. So we have it on our website, but actually we're Chair, we're reviewing both the information on it and its prominence on the website. I'll just get Chris Curran, our head of comms, to forward the link to your officials so that you can have a look at it. But just to say to you that we're doing some work to it at the moment, because the waiting times are really for routine patients. So our longest waits are always routine patients, given that we do prioritise patients who are most clinically urgent. So we will be providing in the future information on urgent patients and the waiting time for urgent patients, as well as routine patients, to give people a better idea of how quickly we're seeing urgent patients. And that'll be made available to our GPs in the West, as well as obviously for public view. I think just to add, Neil, to the comments around cancellations, we absolutely did see unique things this year in our cancellations, because we did have, and it was a feature of both outpatients and inpatient day case work, that people themselves wanted to cancel because of COVID fears in coming to attend appointments in our hospital environment. And also we had new features which were around people who had to be screened and tested and didn't comply with that or weren't able to comply with it. So you will know that we have testing before people have planned surgery, for example. So there were some different features this year that absolutely affected the number of cancellations, as well as the fact that our hospitals were hugely under pressure, particularly at points in the year, and that our ICUs had to expand, and that did affect absolutely our theatre capacity. Thank you, Neil.
Can I just check, Tom, would you have anything to say on the vaginal mesh challenges facing health and social care, or do you want to come back to that?
If you would allow me to come back to that, I would need to take some advice on it, and I wouldn't like to comment just in case that's
Sure, there's a few other comments, questions I would just address. In terms of cancer figures, we are experiencing increases going forward, and coming out of the pandemic now in terms of cancer prevalence. We are going to have to just watch that over the next number of months. Yes, in terms of A&E as well, for cancer load, A&E has been under intense pressure in recent weeks. We have got unprecedented demand at our A&Es, and it is a feature across Northern Ireland for some reason that all A&Es are being under intense pressure. The demand figures have gone significantly up. And in relation to urban policy, we have relied on private hospital provision, and that has been unnecessary to increase our capacity throughout the pandemic. That will hopefully continue into this year because we need to maximise our activity in relation to try to manage our waiting list as best we can. However, we're on record as stating from Minister down, to resolve the waiting list, we will need recurrent monies, and recurrent monies is the best way to build up a capacity in-house, and the in-house service would be the best way to resolve this into the future. I think, Chair, that's most of the issues we've been asked. Hopefully, people will appreciate that.
Yeah, I think that covers everything. All that's left for me to say is thank you once again for coming here today to present this all. It's very much appreciated. I'm sure everyone is happy with the answers, and I think there's only two that you just have to get back to. So well done in that respect. And I would just like for you to pass on the best wishes to Anne Kilgallen, and of course, Neil, you're taking over now. So congratulations on your new role. I'm sure
a few weeks yet, Chair. A few weeks yet, Chair. So yeah, thank you.
Okay, thank you, everyone. Thank you, much appreciated.
Thanks again, folks. Cheers. Take care.
Bye. Okay, members, I'm going to suggest a 5-minute break, and then we will go straight. And I'm going to bring the determination of the application for renewal of entertainment's license for the Abercorn Arms forward, and then we'll take care of all our business after that. So if we meet back here at just after 6 o'clock. Okay, thanks. Okay, members. Martin there had in the chat box about a question he asked to the officers. Martin, you okay if we come back to that after this? I'm sure Karen and all can give us an answer on that there, or if not, come back to us.
Yeah, Chair, if whenever suits Karen to come back, it might be that maybe a paper needs to be brought to the next committee in relation to staff matter, but whatever suits the officers to respond. Thank you.
Martin. Okay. Okay, Councillor Edwards. So members, we is Michael Fahey here? Yeah. Jacqueline Robinson and Jeanette McGonigal.
Yes, Chair. Jeanette McGonigal.
Yeah, thank you, Jeanette. You're okay with WebEx there? How do you use it? I take it with the camera and all that there and the mic, you're grand. So that's good. That's good. We're already starting. I've been speaking to Michael earlier there. So, and Paul is here as well. Paul Larkin.
Yes, sure. I'm online here.
Okay, so everyone happy to move on. So item 8 on the agenda, determination of an application for the renewal of an entertainment license for the Abercorn Arms in respect of which representations have been received. So, first of all, I'd like to welcome everyone to this virtual hearing, which is to facilitate this committee to make a determination of an application for the grant of an entertainment license for the Abercorn Arms, 44 Main Street, Newton Stewart. I'll just take a time now to introduce the members. So if all members would like to introduce themselves.
Alderman Monis Devaney, DP representative for the Strabane.
I'll just call out here through the list. So and I'm Alderman Darren Guy, I'm chair. So Alderman Graham Work.
Alderman Graham Work, Fahan, DA.
Councillor Barr.
Councillor Ruben Barr, Spain, DA.
Councillor Burke.
Councillor Burke, Mer, DA.
Councillor Duffy.
Councillor Sandra Duffy, Ballyarnett, DA.
Councillor Edwards.
Councillor Stephen Edwards, SDLP, Derek.
Councillor Farrell.
Rory Farrell, SDLP councillor for Ballyarnett and Derry.
Councillor Ferguson.
Rachel Ferguson, Alliance councillor for Fahan.
Councillor Harkin.
Sean Harkin, People Before Profit councillor for Foyleside.
Councillor Logue.
Patricia Logue, Champagne councillor for the MERS DA.
Councillor McHugh.
Councillor Rory McHugh, Sean Fane, Castle Derrick. Thank you.
Councillor Mooney.
John Mooney, councillor Waterside, DA, SDLP. Thank you.
Councillor Wright.
Thanks, Chair. Martin Riley, SDLP, Waterside.
And we have the Director of Health and Communities, Karen McFarland, Head of Community Development and Leisure, Barry O'Hagan, Head of Health, Seamus isn't here, Legal Service Officer, Philip Kingston, and Lorraine Shields, and Teresa Johnston, and we have Paul McSwiggan and Paul Rafferty, who will be assisting me through the hearing. Okay, and that's the formalities out of the way. So the order in which everyone will present here to committee is as follows. The solicitor representing the applicant, Michael Fahey, is the main speaker. For Jacqueline Robinson, who's licensee applicant, proprietor of the Abercorn Arms, and representing objector sorry, PSNI officer then is Paul Larkin, who we will hear second, to provide views on behalf of the PSNI. Some of the concerns raised in the representation received, which PSNI have an enforcing role, and representing the objectors from Newton Stewart Community Forum, Jeanette McGonigal. Each party or nominated spokesperson will be allowed an equal maximum period of 10 minutes to present their case. Parties can assume that members have read all papers and statements previous to this meeting, so there's no need for them to read them out again unless they so wish to do so. And following each representation, there will be an opportunity for questions by each party and elected members. So that's basically it. So I will hand over now to Paul Rafferty, who is the principal officer, head of serve or licensing. So he will summarise the salient points of the report on the agenda. So Paul, if you would like to take it away there now.
Okay, thank you, Chair. Good evening, members, ladies and gentlemen. This report relates to the application for the renewal of an indoor entertainment licence for the Abercorn Arms, 44 Main Street, Newton Stewart, in respect of which representations have been received. So by way of background, on 18th of June last year, an application was made for the renewal of an indoor entertainment licence for the Abercorn Arms. At the time of making the application, the applicant was the holder of an entertainment licence for the premises, which was due to expire on the 31st of July 2020. Under tacit consent, therefore, the licence is deemed to remain in force until such times as a determination is made in relation to the application, although, of course, indoor entertainment is currently not permitted under COVID-19 restrictions. The licence applied for is summarised within the report. Members will note that the entertainments applied for in the application include machines for entertainment or amusement. However, these had not been licensed previously, and the applicant has informed me that this was an unintentional error, so these types of machines would not be licensed at the premises. A number of representations objecting to the application were received within the permitted 28-day statutory time period following the date of application. In such circumstances, the order requires Council, when considering the application, to have regard to the representations and to give the person who has made the representation an opportunity of appearing before and of being heard by the Council. And the Council must also give the applicant the same opportunity of appearing before and being heard by it. So the key issues under Schedule 1 to the order, the process that both applicants and Council must follow in relation to the applications for entertainment licences is prescribed. When determining this application, Council must have regard to whether the applicant has satisfied the requirements that Council imposes on applicants for the grant of an entertainment licence, including those relating to the provision of required documentation and certification. Any observations submitted by the District PSNI Commander and the Fire Authority, with whom Council has a statutory duty to consult following receipt of an application, and any representations received in relation to the application. So in relation to the Council's requirements for entertainment licence applications, Appendix 1 summarises the status of the application. Members will recall that in response to the coronavirus pandemic, we are currently accepting receipt of an application form, together with payment of the relevant fee and evidence of public notice advertisements as being a valid application, with the proviso that all required documentation and certification will be submitted before the entertainment licence is issued. If members were minded to, the licence could therefore be granted subject to the production of all required documents and certification to the satisfaction of Council, bearing in mind that by the time the provision of indoor entertainments is once again permitted, some of the previously submitted certificates will have expired. Regarding the observations submitted by Fire Service and PSNI, in response to a consultation sent on the 14th of August, NAFRS advised that they had no objection to the renewal of a licence, and the police did not make any observations. In relation to the representations, 20 identical copies of a letter of representation were received within the timescale permitted under the order. A copy of the letter is attached as Appendix 2. However, while the same letter had been signed and submitted by 20 persons, 7 copies were considered to be invalid as they did not have sufficient contact details to enable identification of the person making the representation. The nature of the issues raised in the representations are summarised in the report. While not a statutory consultee, the Environment and Neighbourhoods team were also consulted and have advised that they were not aware of any previous noise complaints regarding the premises. Before both the applicant and the persons who made representations have been offered an opportunity to appear before and be heard by the committee, and both parties have confirmed their intention to avail of that opportunity. In addition, where the police did not make any observations in response to the consultation, due to the nature of the representations received, police have been invited to the hearing as they may be able to provide information that will assist members when considering the application. The Council's protocol for hearings to deal with representations made in relation to entertainment licence applications will be followed at the hearing, and that's attached as Appendix 4. In determining this application, committee is reminded that it is exercising its discretion and must be mindful of the requirements that apply when a local authority is exercising its discretion on human rights considerations, as summarised in Appendix 5. When granting or renewing an entertainment licence, Council may specify such terms, conditions and restrictions as deemed necessary to ensure the safety of the individuals attending the entertainment and to avoid the entertainment causing undue disturbance to people in the surrounding area. In doing so, Council must have regard to the model terms, conditions and restrictions published by the Department. The standard terms and conditions the Council applies to licences are contained within the Council's management rules for places of indoor entertainment, attached as Appendix 3 to the report. These already include a condition that noise arising from the entertainment on the premises must be controlled so that persons in the neighbourhood are not unreasonably disturbed. However, if members were so minded, a licence could be granted with a special condition relating to noise created outside the premises by patrons. It is important, however, that members take into consideration the practicality and reasonableness of any additional special conditions. So, coming to the recommendation, members are requested to determine the application for the grant of an entertainment licence for the Abercorn Arms, having regard to the representations that have been made, and may decide to grant the licence subject to all necessary documentation and certification being provided to the satisfaction of Council, or grant the licence subject to all necessary documentation and certification being provided to the satisfaction of Council with such additional terms, conditions and or restrictions as committee considers reasonable and appropriate under the circumstances, or refuse the application. Finally, members are reminded that the order provides the applicant with a right to appeal to the County Court within 21 days of the date of being notified of a decision either to refuse the application or to attach any term, condition or restriction to the licence with which she is aggrieved. And in both cases, Council would then have a duty to give effect to an order of the County Court. Thank you, Chair.
Just unmute, Chair.
Well, apologies to you, I didn't give you correct title of Principal Environment Health Officer. It's just to let everyone know at the meeting. So I will move on from now, and the applicants, Representative Michael Fahy, may present their case, and then
Yes.
questions will be permitted from the other party and members, to which the applicant may respond to any issues raised. So, Michael, if you're ready, go ahead there.
Thank you very much, Mr. Chair and other members of the committee. As is apparent, I am instructed today on behalf of the applicant, Ms. Jacqueline Robinson, in respect of the issue of the entertainment licence in respect of her premises known as the Abercorn Arms in the Stewart, County Tyrone. It's fair to say on behalf of the applicant that she has been the licensee of the premises for some 22 years. And indeed has been the holder of an entertainment licence since 2009. In correspondence with the council, there was confirmation received that in that period of time there were no breaches of the licensing law, and that was confirmed to me on the 6th of May of this year. A central tenet of the application for the licence, I say to the chair and the committee, involves a number of criteria which have already been touched upon by Mr. Rafferty. But I think they do benefit from a degree of reiteration insofar as that they must include observations from the PSNI. And Mr. Rafferty has fairly indicated to me in correspondence, and indeed again today,
that having been placed on notice, the PSNI do not indicate any issues of concern as regards the premises and the operation of those premises by the applicant, Ms. Robinson. Allied to that, we have already heard as well that the fire service as well have expressed no concerns about the premises and indeed the way that the premises are conducted, having of course had an entitlement to do so. The committee, of course, must also, in accordance with the legislation, have regard to any convictions relevant to the applicant. There are none of those at this point in time, so I say that those criteria which have to be met are duly met without any issues of concern. The reason why we're all here today, of course, is to deal with the issue of the licence and primarily, but to also to consider what, of course, is the perfect entitlement of an objector or objectors to indicate to the committee any concerns that they may have as regards the granting and thereafter the issuing of the entertainment's licence. A representative is in attendance, and as I say, I do reiterate that they do have a perfect entitlement to attend and make such representations as they see fit. I did take time to write a letter to the chairperson, Mr. Guy, on the 7th of May of this year. Now, on the same date, I also sent an email to Mr. Rafferty, and this was absent from my letter of representations. And I think this goes to the core of the objections in my respectful submission to the committee here today, is the issue of the perceived behaviour of residents who would have been placed by the housing executive on an emergency basis in accommodation which was provided by the applicant, Mrs. Robinson, at her premises in the main street of Newton Stewart. I can advise the committee that following a contract between herself and the housing executive in Northern Ireland, that Mrs. Robinson did provide emergency accommodation from in and around the start of 2019. But this, and this is very relevant, ceased in March of 2020. Now, if the committee looks at the central tenets of the letter of objection, I think it's fair to submit that the vast majority of concerns, as intimated in the generic letter, do seem to arise and emanate from the alleged behaviour of residents who were properly allowed to reside in the Abercorn Arms for the period as outlined. Now, notwithstanding the fact that the applicant does not accept the veracity of the letters and now the letter of objection, I think it is very important that the committee look at that aspect and look at the fact that from March there are no longer any residents in that bar, and Ms. Robinson also indicates to me that at no stage in the future would she ever engage in that practice again. So there will be no further tenants residing in her premises on the basis as already outlined to the committee here today. Again, as regards the letter of objection, it's my respectful submission to the committee here today that the allegations contained within same appear to be generalised, and they do not appear to outline any specific instances of behaviour of people who may have been linked to the premises of the applicant. And I think it's also of concern that the same letter, it's more than being a letter of objection. I say that this is more akin to a petition, but as outlined by Mr. Rafferty very fairly earlier and indeed today, it was not possible to identify a number of the persons who penned their signatures to the letter. So again, I reiterate that it does not particularise any instances which I believe would give rise to concern about the issuing of the entertainment's licence. Now, the entertainment's licence, as everybody who is involved here today is aware, simply allows the provision of entertainment during what are the normal prescribed licensing hours for a bar. Now, as has already been indicated by Mr. Rafferty, for example, any musical entertainment is not permitted because of the current restrictions that we're all living under at the moment. But as I say, the entertainment license purely allows my client in normal times to conduct activities within her premises, but within the normal prescribed license and hours. And for her to go beyond that requires an application under Article 44 of the license in order for additional hours. So today's application is merely to allow her to operate and engage in that activity during normal licensed hours. Now, the concerns that we would all have, for example, about antisocial behaviour in public generally emanates in the early hours of the morning, and you don't normally encounter issues during normal licensing hours. So one could give an example of a nightclub, and a nightclub obviously has the additional hours that are permitted, and people all empty onto the streets in the early hours of the morning, and the alcohol and the fresh air then gives rise to contact with police and instances of public disorder. I say that that is not the case here today because of the fact that we're dealing with what effectively has been a license in place now for some 13 years. Is just the continuation of that license with, as I have already said, no issues of concern up to now. Now, as regards the as regards my client directly in the way that she conducts her premises, she will say through myself that she is a very responsible licensee. She has also told me recently as well that she operates a 24-hour CCTV system in her premises, and she has on diverse occasions, and I'm sure the police will be in a position to confirm this, has on diverse occasions assisted the police as and when they have asked her to do so, and provided CCTV footage as and when they have asked to do so in respect of any matters which may have occurred in the area which is within the view of her CCTV cameras. Now, if we could move back to the letter of objection, I have already indicated my concerns about the general nature of that. Now, what that letter, in my respect and submission to the committee, does not deal with is the fact that the Abercorn Arms is only one of 5 licensed premises in the very small village of Newton Stewart. I have no doubt that that there are similar patrons who attend all 5 premises, and the letter of objection does not touch upon in its generalized commentary about what could very well be patrons who are either attending or leaving the other licenses or leaving the other licensed premises in the very small area where they are all based. Now, as regards the objections itself, they were lodged on the 18th of June of 2020. Now, we have all been operating obviously under the pandemic restrictions from March of 2020, but Ms. Robinson would have been permitted to open her premises in accordance with the relaxation of the restrictions in July and August of 2020, and furthermore for a short window in December of 2020. Mr. Rafferty very helpfully as well indicated to me in previous correspondence that there have been no concerns since the complaint was filed, and indeed no concerns prior to the issuing of the license in respect to my client. So we're dealing with an instance now whereby an objection, of course, of which there is a total entitlement to make, is the only issue of concern that I say, Your Worship, or that I say has arisen in respect of these premises. And I think that's a very pertinent point and goes to what I say about the fact that my client regards herself as a very diligent and proper licensee. And as I say, her concern is that if she is deprived of her entertainment's license, then that goes to the very continuation or the ability to continue the operation of those premises if she is not permitted to allow to engage in that activity as outlined. As regards that, as I say, the license has been in place since 2009, and Ms. Robinson operates the business with her partner there, and there are some 3 other members of staff. So what we do not want to see is the loss of employment, which would be inevitable if there were not to be an entertainment license attached to the liquor license in respect of these premises. The applicant finally, I would say the applicant is operating in very difficult circumstances, like every other business individual in the current climate at the moment. She has been deprived of operating her business for the bulk of 2020 and for the entirety of 2021 to date. This has resulted in a very severe financial impact. And as I say, the deprivation of the entertainment license would only accentuate and add to what has been a very, very difficult 18-month period in which to operate any business. The council, as has already been as already indicated by Mr. Rafferty, can issue a license on whatever terms that they see fit. They can attach extra conditions which are reasonable to the issuing of that license. I say that the license as well can be reviewed at any stage in the 12-month period. I say that if there are concerns from police or any other relevant agency, then that can be brought to the attention of the council, and that can lead to the revocation of the entertainment's license. So unless there's anything further that I can assist the committee with today, those would be my submissions on behalf of the applicant, Mrs. Robinson, here today.
Thank you, Mr. Fahy, for that submission. I now will open it to the floor. If the objector, Jacqueline Robinson, would like to ask any questions, she is permitted to do so at this time.
Sorry, Miss McGonigal, you mean, I think, Mr. Guy?
Sorry, I'm reading it off my list. Sorry, apologies. Jeanette McGonigal, if you would like to ask any questions at this time of Mr. Fahy.
Yes, Chair, we have.
Go ahead there.
Mr. Fahy has said about financial hard time. We want to know if she has financial hard time in Newton Stewart area, well then why is she trying to buy housing in the area if she's financially hard?
Well, Ms. McGonigal, that's not relevant to the issue of the license here today. What I was merely saying is that it is very difficult for any business to operate, and I'm talking about the business that she is operating under the liquor license and the associated entertainments license, Ms. McGonigal. So I think with all due respect, what my client, the applicant, does outside of her profession as a license holder is not relevant to the application or indeed your objection. And indeed,
Just come in there. I'm just going to step in there and overrule that there. Mr. McGonigal, that's not in keeping with the license
point of order.
We're here today for. So I'm sorry that I will not take any more questions to that. So if you'd like to continue. Sorry, go ahead there, Councillor Edwards.
Chair, in last month's meeting, I believe that these sort of evidence sessions were conducted in private by committee members. Has the procedure changed on that? If I remember correctly, last month, I just wanted to raise that point, Chair. Thank you.
No, that when this or go ahead, Philip. Yeah, go ahead, Philip. Go ahead.
Sorry, Chair. This part of the meeting was conducted in public, and then as you outlined the procedure at the start, Chair, the meeting went into confidential business in order to conclude its deliberations. But this part of the meeting was done in public business.
Okay, thank you, Philip, for that there. So I'll go back to Ms. McGonigal, or Ms. McGonigal. Would you like to ask any more questions?
No, Chair.
Thank you. Thank you. I will now open it to the floor if any members would like to ask any questions of Mr. Fahy.
Chair, Councillor McHugh.
Go ahead there.
Yeah, thank you, Chair, and thanks, Michael, there for your contribution. You referenced there about the letters of objection, and you seem to suggest that they were more akin to a petition rather than letters of objection. would you accept that it could be a situation where somebody within the community has taken a lead on the issue and who has formulated a letter and then consulted with other people who would share the same objections, and that they then would have agreed to sign that letter? And I accept that some of them, even though we haven't been provided with the actual letters, we don't see the signatures. Do you have a copy of what's contained within the actual letter? But would you accept that might be the case, that one person or a group of people might have formulated a letter and then other residents who agree with the letter were happy to sign it? Thank you, Chair.
Councillor McHugh. Michael, if you would like to come back in there.
Thank you. Look, of course, I'm not ruling that out, but if you look at the letter itself, it starts with, "I am writing to you to object to the entertainment license," and then it goes on to say our reasons. I think, Councillor McHugh, as well, my concern was the fact that whilst there appeared to be a number of signatories to the letter of objection, Mr. Rafferty of the council confirmed to myself, and I'm sure to yourselves as well, that a number of the signatures were illegible. A number of the contact details were not correct. So really it was just, that was my view and that was my submission. I predicated on what my view was of that. But I go back to what you say. Of course, there are situations whereby a group of people do get together and do pen their signature to a document in order to support the entire contents of that. So I'm not contending that that's not possible. Of course not.
Thank you. That's me.
Thank you, Councillor McHugh. Councillor Ferguson.
Chair, Mr. Fahy, I know you said that there was no concerns raised from the PSNI or the fire service, and I note that there are no concerns coming through from our environmental health. But has your client had any residents come directly to her with concerns or complaints, or raised anything directly with her, not in a formal matter, but just day to day?
Well, I can't say, I don't know the answer to that, Councillor. But all I can say is that anybody who appeared to have concern appears to have penned their name or penned their signature to the letter. So I can't confirm whether or not they have done. All I have said is that, and perhaps I could maybe say this as well, Councillor, that if anybody has concerns about antisocial behaviour, or indeed anybody engaging in criminality or public order offences, they are, of course, perfectly entitled and should bring their concerns to the attention of the PSNI. And the PSNI, upon receipt of any complaint, as you undoubtedly will agree, Councillor, are obliged to investigate the authenticity and veracity of any complaint, whether or not the complaint has substance or not. So rather than the point about whether or not these people have voiced concerns to my client, the licence holder, I think that the proper course of action is to attend with the police, and the police have a myriad of powers to impose conditions on the premises, or to warn the operator of any premises that if any alleged conduct continues, then obviously issues can be raised with regard to the validity of the licence and continuation of the licence. And as I say already, if they give rise to any criminal offences, then those matters can be investigated and then reviewed by the PPS in due course.
Thank you for that. Councillor Edwards.
Thanks, Chair. Thank you, Mr. Fry, for your comments. I just want to ask Mr. Fly, is he aware of a large public meeting that occurred a number of years ago? I think it was about 3 years ago in Newton Stewart, a large congregation of the local public to deal with concerns relating to Abercorn Arms and the antisocial behaviour that is alleged to have occurred there. And in his contribution there, he mentions about the housing executive and the relationship is ended with the housing executive. How can we be assured that such a relationship will not begin again, given the need for emergency social housing in the wider area? Thank you, Chair.
Well, I think the aspect, Councillor, with all due respect, with regard to the public meeting a number of years ago, there's no mention of that. That did not give rise to any formal objection to the issuing of any license or any other requirements in respect of these premises. As regards your final point, that's you talk about the need for emergency housing, and of course we're all aware of the fact that there's a very abject need for emergency housing, but Mrs. Robinson went down that road before and has indicated very clearly that she will not be doing it again. So unless you're saying, Councillor, that you accept that perhaps she was performing a very altruistic role in the community by providing accommodation on an emergency basis, which, just on that point as well, aside from any of the negative, and there have been a lot of negative connotations in the letter of objection about this arrangement that my client had with the executive, she also provided emergency accommodation during that period of time to homeless people, to people who had unfortunately been involved in the breakup of a long-standing relationship, to mother and babies who had been put out on the street. She performed that role and offered housing to those individuals. And I note that there is no reference or accreditation or any compliments directed in her direction for the fact that she did perform that role. So, but aside from whether or not it was a good thing to do or not, she won't be doing it again. So unfortunately, the executive will have to try and find other ways and means of housing people on an emergency basis.
Chair, can I come back in there? Is that okay?
Okay, yeah.
Mr. Fahey, I do agree with you. Emergency social housing, it plays a massive role. There's a lot of vulnerable individuals out there, and I, like other representatives in this call and political parties, have called for more capital investment in the wider area into social housing and emergency social housing. But in my personal view, is above a bar the best place to house vulnerable people? In my view, I don't think it is. So you could spin that any way you want, but that's my personal view on it. Thank you, Chair.
Well, I think just to answer that matter briefly, and I've already touched upon that as well. Whether or not it was a suitable place or not, the fact remains is that they did provide emergency accommodation. Whether or not it was over a bar or not, I don't believe is relevant. But I think the relevant factor, which I will say again for today's proceedings and for the committee to consider, is the fact that that arrangement is not an end. And indeed, we're actually a year past since the last time that she opened her doors to the executive for any emergency housing. So it's over. It's finished. So whether or not it was a good thing to do or not, Councillor, I think you've already tacitly accepted maybe some of the good virtues of what she did. The fact remains, she can't change the fact that she had available accommodation. She can't change the fact that she attempted to offer a service. And I think the fact that it was over a bar, yes, it's not the best place to have any emergency housing, but that's not what we're dealing with here today, because that ship has sailed. That matter is now at an end. And as I say, we're now some 15 months or 14 months from the day and hour when the applicant last welcomed anybody into emergency housing. And as I say, she ended the arrangement with a degree of regret, because as I say, she did and still believes to this day that she did provide a very good service. And you yourself, Councillor, as well, have said that every rural town is crying out for emergency housing, and particularly with the cost of rent, the inability of to obtain any rented premises and everything else, and all the issues associated with the pandemic. So unfortunately, it's a service which was there. Whether or not it was ideal or not, I don't believe is a live issue today. And I believe it's not an issue to be considered today, because it's no longer in operation and should not therefore be considered as a factor as relevant today, in my respectful submission to the committee here today.
Thank you, Mr. Fahey. Councillor Mooney.
Thank you, Chair. Thank you, Mr. Fahey, for coming to address the committee today. Can I just take you to paragraphs 4 and 5 in relation to the objectors? letter, and really my question is, do you have any specific instructions in relation to paragraphs 4 and 5, i.e. the issue of alcohol being served outside the permitted hours, and secondly, the next paragraph in relation to underage drinking? I'm just really wondering if you have any specific instructions from your client in relation to
Well,
that.
other than to say, Councillor, in response to that, in respect of those two paragraphs, I've taken my client's instructions regarding all aspects of the letter of objection, and she vehemently denies any breaches of the licensing legislation which pertains to her operating of those premises. And indeed, as I say, if that were to be the case, our client operates the 24-hour CCTV, and also as well, she also ensures to the best of her ability that there is no underage drinking on her premises at any stage. So in answer to your question, have I any specific instructions? Yes, she does not accept any of the allegations contained within the effectively contained within those two paragraphs.
Thank you, Mr. Fahey. Thank you, Chair.
Councillor Mooney. Alderman Devaney.
Chair, for allowing me in. One of the questions has just been answered before me, and I was just going to ask the question in around the client providing emergency housing. I'm just wondering, Mr. Fahey, did she receive an income for providing that service?
Yes, of course she did. She provided a service in the same way that any other landlord or owner of property would do, who is effectively engaging in the contractual relationship with the executive. So the answer is yes, she did.
No, that's okay, Chair.
Thank you, Mr. Fahey, and thank you, Morris. I have no other indicated speakers at this part, so I am going to move on.
Chair, briefly, just could I have one follow-up question very briefly?
Yeah, go ahead. Go ahead.
Chair, that agreement that was in place, the emergency housing agreement with the housing executive, when did that end again?
The 31st of March of 2020.
Thank you.
Thank you, Councillor McHugh. So I'm going to move.
Sorry, Chair, can I ask another question there to Michael? I'm sorry to interrupt you, Chair.
Yes, go ahead. Yeah.
I, as a resident myself here in Newton Stewart, I am aware of underage drinking in that premises. I have seen it for myself. Sometimes even the CCTV does not work there. And another thing I want to bring up, it doesn't close at the supposed times that the premises is supposed to close, even with the entertainment on that license premises.
Thank you for that, Mr. McGonagall. Indicated. I'm just going to check if you're, Philip, can I check, is non-members allowed to ask questions?
Yes, Chair, non-members can ask questions if they wish.
Yeah, okay, thank you. Alderman Hussey.
Thank you, Chair, for permission to pose the question. As you say, I'm not a member of the committee, won't be involved in the decision making on it. It's a question to Michael. You referred there that council are entitled to place their own conditions. Given that the applicant has already agreed that she will not be entering into an agreement with housing executive again, and to allay the fears of residents on that issue, would that be an unreasonable condition if committee were so minded to place that condition that such use of the premises would not be allowed going forward? Thank you.
Would you like to come back in there, Michael?
As I said, Councillor Hussey, and thank you for your question there as well. I did indicate, of course, that the council had a wide remit to attach conditions to an entertainment license. So my client has given me specific instructions that she will not be engaging in any contract with the executive in the future. So in answer to your question, if that is the desire of the committee post consultation after today's hearing, I am able to indicate that the applicant, my client, has no objection if that is felt to be a necessary condition had to be attached to the license.
Okay, thank you, Michael. I'm sure members will look at all options when we break out. I'm going to move on now. So the interested parties representative, Jeanette McGonigal, may represent their case, and then questions will be permitted from other parties and members to which the applicant may respond to any issues raised. So, Jeanette, if you would like to go ahead there.
Thank you, Chair. I'm Jeanette McGonigal. I'm Vice Secretary of Newton Stewart Community Forum. I'm speaking on behalf of Newton Stewart community. I would like to start by saying any entertainment in these premises, Abercorn Arms, causes residents a lot of stress and anxiety. For example, elderly residents being woke out of their sleep at early hours by individuals leaving Abercorn Arms. These individuals are highly intoxicated and have known to bang on doors, smashing bottles, shouting sectarian abuse, and even going as far as breaking windows of businesses. Flower pots are being destroyed. Male and females individuals have been known to urinate on the streets and at people's doors. Individuals also have entered people's homes without permission. Now, these incidents have been reported to us confidentially from the residents in the surrounding areas. The elderly residents in this area are feared for their lives due to unsavoury people in the Abercorn Arms, to which the Abercorn Arms have brought to the premises in the last 2 years. The elderly are fearful that this will happen again. The views of the people are worried and concerning that if an entertainment licence were to be permitted to the Abercorn Arms due to the unsavoury people returning and again, there has been no complaints involving the other public houses in the surrounding area. Since Abercorn Arms have been closed during COVID-19, people to which have resided in the B&B have all been allocated. The community has been much more at ease. Newton Stewart Community Forum was established in 2019 due to the concerns and well-being of the community. We will continue as a community forum to have regular meetings to reassure the community that incidents do not. Thanks, Chair.
Thank you. Is it Mrs. McGonigal? Yes?
Yes.
Yes,
Chair.
sorry. Yeah. I will now open it to the floor. So if anyone would like to ask any questions to Mrs. McGonigal, and Alderman Devaney, you're first there.
Thank you, Chair, for allowing me in, and say thank you to Jeanette for giving us her take on it. I want to just ask Jeanette, she talks about a number of incidents, probably ongoing issues brought to her committee and her board or whatever it is. Have those incidents been reported to the PSNI, or has she any log of those incidents being reported?
The incidents have been reported to our community group As I am aware of, they haven't been reported to the police because the people of that surrounding area is in fear. That answers your question.
Okay, thank you, Jeanette. Councillor Edwards.
Thanks, Chair, and Jeff, thanks for coming in today. And it is very brave of you, because I know these things aren't easy. Jeff, I'm just wondering, are you aware of any sort of events that have occurred and around near the houses around the bar? Is there anything that's been reported into the forum about that? Thanks, Janet.
Yes, Councillor Edwards. These incidents, there has been incident has been reported to the police, to the PSNI community policing, with people urinating street. I know there was one incident as well where there was people going into a person's house without permission. That has been reported. And also there has been 3 deaths in that property, in the Abercorn Arms as well, has been reported to PSNI.
Okay, thank you, Councillor Edwards. Councillor McHugh.
Thank you, Chair, and thanks to Jeanette as well for her representation here today. First thing, Jeanette, you referenced there in response to a question about reporting some of these alleged incidents. You said maybe that some of them weren't reported because people were in fear. Could you clarify maybe just what are they actually in fear of? Are they afraid of the people who are involved in these alleged incidents, or are they afraid of the PSNI, or who exactly was she referring to? That's my first question, Chair. Do you have a couple more?
Yeah, thank you. The people is in fear of the individuals that is actually coming out of that premises, and banging on their doors and windows and smashing bottles. They actually fear for their lives that it's going to happen again.
Okay. You might have heard me earlier just asking about the arrangement with the housing executive, and the solicitor, Mr. Fahy, clarified there that ended the 31st of March 2020. Now, in your opinion, has that had an effect on the alleged antisocial behaviour since that agreement has ended? And there was reference made earlier as well to possibly conditioning a licence, that the accommodation part would be conditioned that would be withdrawn. In your opinion, do you think that would allay any concerns or address the alleged antisocial behaviour?
Well, there has been known of alcohol and drug use in there. We are aware that of the 3 deaths that was in the Abercorn Arms was to do with alcohol and drugs. Answers your question.
Is that you finished there, Rory, with the questions? Yeah. Yeah.
Come back to could I get an answer maybe just to that query about the arrangement ending last year? Does Ms. McGonigal
Yeah, oh yeah.
Seen any reduction in that behaviour since then? Previous year? Thank you, Chair.
Yes, since last year, since COVID came in last year, we have seen a reduction of antisocial behaviour, drugs abuse, and as I say, intoxicated people as well, and the like flower pots and smashed windows and stuff, it has all decreased.
Thank you, Jeanette. Michael, I think, were you looking on there?
I just wasn't aware of how you put up the hand symbol to speak, but I think Ms. McGonigal, the other people involved today have probably answered a lot of my questions, but I think what Councillor McHugh was trying to ask you was that given the fact that the arrangement that Ms. Robinson has with the executive is now at an end, do you not, or do you accept that, or would you be content to know that that is no longer going to be the case moving on?
No, because as I know, as a resident here in Newton Stewart, I still see and I still believe that Miss Robinson is still bringing in unsavoury people into our area, and even into opening the bar as well, where she is supposed to be closed at this present minute.
Okay, Councillor Ferguson.
Chair, I think Michael was speaking there, but with his mic on, mic off. I just want to check he's finished.
Well,
sorry. Yeah,
thanks very much for that. I think it automatically goes on and off. Thank you very much for that interjection. I was just going to say that you say that you still have concerns and you talk about people having passed away and that, but does the setting up of the community forum, you said, I think, Ms. McGonigal, that was set up in 2019, is that right?
Yes, our community forum had been set up in 2019. The only reason why we set this forum up was because of the unsavoury people that Jacqueline Robinson brought into her premises at the Abercorn Arms. This caused a lot of fear and anxiety in our area. It was because of the kind of people that she was bringing in, and to do with her late opening hours as well.
I have no further questions. Thank you, Mr. Chair, and all the members of the committee. Thank you.
Mr. Ferguson.
Thank you, Chair, and I just have a few questions. Ms. McGonigal, it's similar to what I asked Mr. Fahy. As you as a community association, have you approached the applicant with your concerns, whether it be with a letter or personally? And also, in one of the in the information that we've received, there is a claim that there's a number of other premises. How can you make us aware that it's definitely this one premises, not necessarily some of the others that these people are coming to? And then I've just got one more after that, if you don't mind.
To answer your question there, Miss Robinson is very unapproachable. We did hold a meeting in the 2000 Centre where Robinson was very suppressing to me. She was very unapproachable, just put it that way. And she has also threatened me, and she has also threatened members of the community forum as well.
Thank you, Ms. McGonigal. Can I just check? Is there a way in which you know that these people at late at night are coming out of the applicant's premises? And also, could you just let me know how you're aware that the CCTV doesn't work? Just in that sense, thank you.
It's the residents that is in the surrounding area has informed us as a community group on they are seeing who's coming in and out of her premises. When any incident happens in the surrounding area.
Okay, Jeanette, thank you. Councillor Mooney.
Thank you, Chair. I think Councillor McHugh asked the question I was going to ask about the behaviour during the currency of when the premises were being used as emergency accommodation. Would it be fair to say, Mr. McGonigal, that your suggestion of the behaviour, would that have been at the time when this accommodation or these premises were being used as emergency accommodation?
Yes, at the time, and it still is.
It still is, even
Yes.
since March last year.
Yes.
In what way have you witnessed anything personally yourself?
Sorry?
In what way? And I mean, would you have witnessed anything personally yourself?
Yes, I have. At the present minute, she is intimidating me at the present minute due to this licensing. She is actually coming up to the front of my house and turning and sitting and has her full light on my front window. Now she has made other threats to me as well, and has shouted abuse at me out on the main street.
Have you gone to the police about that?
Yes, I have. I've actually spoken to our community policing on the matter.
Okay, Chair. Thank you, Mr. McGonigal, and thank you, Chair, for that.
Thank you.
Okay. Councillor Duffy.
Thank you, Chair, and thank you, Mrs. McGonigal, for coming along today to the committee. Mrs. McGonigal, I was going to ask there around that you had said that you and other members of the committee were threatened, and I was going to ask had you reported any of that to the police, but you've answered that to Councillor Mooney, that those threats have been reported to the police. Is that right?
Yes, they have.
Yeah. Yeah, and then just the other question that I have, Mrs. McGonigal, is in relation to just looking for clarification. You talked of 3 deaths on the property. Could I ask just for clarification around those 3 deaths? Were they in relation to the accommodation side of the business or the bar side of the business? Just to get clarity on that, because I forgive me if it was in the papers. I didn't see it in the papers. So if you could clarify those 3 deaths for me, thank you.
Both. If that answers your question.
They were in relation to.
Yes, both.
So
both, as they were getting drugs to swell, both alcohol and drugs in that premises.
No, I think you misunderstood the question.
Sorry.
Were the 3 individuals who died, were they staying in the accommodation or were they using the bar?
They were living in the accommodation.
Okay, thank you.
Thank you, Councillor Duffy. Alderman Devaney.
Thank you, Chair, for allowing me in. And Jeanette has answered the one on the intimidation. Was it sent on to the police, reported to the police? Jeanette, you did say there in one of your comments, open when it should be closed. I would like a bit of clarification in around that. Is that it was open maybe too late after hours, or do you believe that there was breaches of the COVID regulations? I just wanted you to clarify that, or would it be both? I just wanted you to clarify.
Yes, it's opened after hours where it was supposed to be closed, and during COVID-19, which I believe that she broke COVID regulations.
Thank you for that.
Okay, Morris. I have no other indicated speakers, Jeanette, so I am okay.
That's right. Can I just make one reference? My
go ahead.
apologies. Ms. McGonigal, you said that you and other individuals have been the subject of threats and intimidation by the applicant. Is that correct?
Yes.
And you said that you brought this to the attention of police. Is that correct?
Yes.
Did you make a statement of complaint to police, i.e. a witness statement, which would have been written and recorded by the police officer and signed and witnessed by him?
No, we have mentioned it to our community police officers.
Okay. And I take it then that the allegation that you say that the applicant has breached the licensing hours, I take it that you did not make a formal written statement of complaint to police in respect of that either?
I didn't have to. The residents were ringing in to the community policing on that
Right, okay.
matter.
That's fine. Okay. Okay. Thank you very much, Ms. McGonigal.
Thank you, Michael. Councillor Edwards.
Yeah, thanks for letting me back in. And I suppose I can relate to what Jeanette is saying, because I said, well, I'm only in post for a year. It's been an issue raised with me, but I've been involved locally in the party, and we have received complaints, and we do refer people on to the PSNA regarding this property. And I could say a lot more, Chair, but I'm not going to say a lot more. I open myself up to libel, but I could say a lot more on the issue. Jeanette, just a final question. I know that a lot's been made of the number of incidents going down in the last year, but obviously they would, because of COVID, is shop bars. I'm just wondering, is there sort of like, what's the community feeling about bars reopening again? Is there a fear that this sort of behaviour could start up again in the local Newton Stewart community?
Yes, the people in Newton Stewart here, they are feeling devastating at the minute, that the fear that opening up the bars again, they're fearful, and you know that this thing is going to occur all over again.
Thank you, Jeanette.
Okay, I've no other indicated speakers. Just a few questions for you, Jeanette. I'm aware. I'm not too familiar with the Newton Stewart area. I am aware where the bar actually is. Can you ask me, how close to the premises do the objectors live? And is the complaints mainly due to patrons returning from a night out and causing unacceptable levels of noise? That's my first question, so if you would like to answer there.
Chair, as confidentially, I would not like to say how close that they are, but I will just say that they are in close vicinity.
when you say close vicinity, are you talking within 200 yards or?
Yes.
Right, okay, no, that's grand. Just a quick question, and Morris had indicated about, you stated that about alcohol being served outside the permitted licensing hours. Are you implying that there was a lock-in type basis, or were carryouts being sold from the bar?
Yes, there had been lock-ins in that premises, and plus carryouts as well. And they actually had been hiding in which they class as bar 10 or 10 bar, which is off that premises, it's adjacent to that premises, which Michael's client has got the keys for that premises.
Right, just two more questions. Just, has the drug use been taking place within the Abercorn Arms bar, or is it in the accommodation area adjacent to the bar, which has been used by the housing executive to house those classed as homeless?
I am aware that it is in both.
And
both in the bar and in the accommodation.
okay, and has any of the stated feelings of intimidation or fearfulness by older residents come from those actually drinking in the Abercorn Arms, or is it mainly due to those availing of accommodation at the premises?
Sorry, can you say that again, please?
Sorry, no, yeah, no problem. No. Has any of the stated, you talked there in your letter to the committee about intimidation and fearfulness by older residents in the area. And I just want to know, does that fearfulness come, is it a direct from those drinking in the Abercorn Arms, or from those who are availing of the accommodation and of the premises of the like the housing executive clients?
Yes, it's actually both, Chair.
Right. Okay. I have no further questions, so I will move on now. Jeanette, thank you for that there. So I will move on now to the responsible authority. PSNI officer Paul Larkin may present their case, and then questions will be permitted from the other parties and members, to which the applicant may respond to any issues raised. So Paul, if you would like to take it away there.
Yes, the stuff that I have here in front of me was compiled by Sergeant Davy McElwain. So I'm reading off the information that I've been given. So Davy's had, Sergeant McElwain has had more dealings with the bar and the accommodation more than I have. Davy's given a small report, basically explaining that. I'll just read most of what he has here, what he sent me. Let's see, sorry. I have it in front of me, and of course, as soon as you go to read it, it disappears. There we go. Like I said, this was conducted a few weeks ago. This as Sergeant McElwain would say, the main problem, as perceived by most of the general public, emanates from the fact that the premises have been used as emergency housing by Northern Ireland Housing Executive for a number of years. And quite a few of the people who were provided emergency housing within the Abercorn Arms have then went on to settle within various housing estates within Newton Stewart. However, some of those people were quite prolific at criminal and offending and antisocial behaviour, which resulted in the community feeling that the housing executive were just using Newton Stewart to house all the problems from all over Northern Ireland, and the Abercorn Arms was the capitalist for this. He does, as previously mentioned, towards the May or June 2018, there was a private meeting which had been planned in the Newton Stewart 2000 Centre, with some concerned residents and the owners of the Abercorn Arms, along with the housing executive, PCSP, elected representatives and police to try and air some of the problems and try to find some solutions. Unfortunately, the details of the meeting became widely known in the public, and a large crowd of residents from Newton Stewart turned up on the night. And in Sergeant McElwain's opinion, it turned into more of a shouting match, and nothing, I think, constructive was gained from that meeting. However, he does state that the housing executive did review their practice of using the Abercorn Arms for emergency housing for a period of time after this, but did return to make use of the premises in the future after that. In conclusion, Sergeant Michael Main would say that the general public associate any trouble caused by those who at some time or other came to Newton Stewart and stayed in the Abercorn Arms with the premises which he felt was wrong, and responsibility for any criminality, antisocial behaviour lies solely with the individual and is no way associated with the Abercorn Arms. He does state he does not know what impact the loss of an entertainment licence would have to benefit the wider community. He goes on to actually give me a list of all the incidents and since I don't find the dates here. The first incident that he has highlighted, 31st of January 2019, right up until the 14th of December 2020. And it's just basically one line of what the report was. So that's all I really have. I can't really speak much more personally. I've only met with Jacqueline Robinson on a few occasions to discuss a couple of licensing matters, and we addressed a few problems with that. So I'm happy to answer any questions on what I've got here in front of me. Anyone? Thank you, Chair.
Paul, thank you for that input. And Alderman Devaney is first there.
Thank you, Chair, for allowing me in, and thank Paul for that. He did say there were incidents between 31st of the 1st, 19 and December 2020. Can I just ask Paul, in light of the recent climate that we're in, is he aware of any breaches of the COVID regulations, or have there had to be any visits by PSNI to the establishment by the PSNI? And if there has there been any fines issued to patrons or the owner? That's it, Chair.
Yes, Boris. There has been some reports received by police that where there was alleged COVID breaches. In fact, that last one on the 14th of December was one. Police checked it, and it's been signed off here as no further police action. So my presumption that there was no COVID breaches at the time. We also conducted a number of routine inspections. One dated here the 20th of August, where the police reported that everything was all regular. And I believe that time may have been during the initial relaxations of the licensing regulations around COVID at that time. There was also routine inspections during the time and during normal times before COVID. But as regards to COVID regulations, to the best of my knowledge, no fines or sanctions has been issued against the bar.
Thank you, Paul, for that. And you have no recollection of any incidents, even in the recent lockdown, the recent one that we're in, even into 2021? You're not aware of anything?
No, that's correct, Morris. I'm not aware of anything. And nothing's been brought to my attention by Newton Stewart neighbourhood team. Like I said, the last incident I have here in front of me is the 14th of December 2020.
That's all for me. Thanks, Chair.
Okay, thank you, Alderman Devaney. Jeanette, were you looking in there?
Yes, Chair. I was looking in due to what Paul was saying there. I would like to mention about the breach of COVID restrictions last week on this premises, in which he was rung by community policing officers. Both Davy McAween and George Deeney, community officer, actually went out to the premises and checked it due to these restrictions. Now, there was people in that vicinity beforehand, and they were able to see that the police was actually outside due to CCTV, and by the time Miss Robinson got down to the premises, the people in that premises had scattered. And also it was on social media as well. I would just like to refer to that.
Okay, thank you, Jeanette. Who was that calling there? Jacqueline?
Yes, the owner of the African Arms.
Yeah, you're permitted to speak. Yeah.
Yes, look, I would just want to put a few points forward. You know, there's a lot of allegations made against my place. I have a CCTV to go back from lockdown that I have never opened my place, and the police can come clean and forward and view my CCTV. She said last week, I think now I have to go to the police for this matter. She said that I was open and the police called. I was hiding people. The camera's there. I tell the police every time they come to my premises, inspect my camera. I don't have anything to hide. She's made so many allegations about carry-out. I don't even sell carry-out to drink. I don't be late after hours. The police can come and check the CCTV at any time. I'm locked up night at 9:30, 10 o'clock. I also have to speak to Michael after this meeting. She said that I'm up at her house at night putting lights and looking at her window. That is something a child would do. My goodness, why would I go up there and looking at her? She has actually the problem trying to run my premises down, and I don't break the law. You did hear from Mr. Larkin, and you have heard from Sergeant McElwain, and I think that answers enough that I'm running a proper place. So thank you for letting me speak.
Thank you, Jacqueline, for that there.
Thank you,
and I'll move on next to Councillor McHugh.
Thank you, Chair, and thanks as well to Paul there. Just, Chair, for clarity, could you clarify, Paul representing the PSNI there, he read out the statement from Sergeant McElwain. Could Sergeant McElwain have been present here today, or is it specifically Paul that deals with the PSNI on these matters in relation and liaison with the council?
But Paul is their liaison officer, so I think it always. I know maybe Karen or Philip would be able to answer that better. I've only done the two.
Certainly, Paul, Chair, would have worked with the licensing group and the licensing committee. When there was such a thing, we would always have taken our representations from Paul as the licensing officer for the area in relation to these matters.
I'll look for that.
Thank you for the response there. It's just it's a bit disappointing that you get a statement read out from another police officer who, as Paul said himself, is more familiar with the issue, but yet now as councillors we don't get the opportunity to ask that particular officer questions on his statement. If we needed clarity or any further questioning of the issue. But anyway, moving on. In that statement, Sergeant McElwain has said about the public meeting, and I'm aware myself that there was a public meeting that took place there. Sergeant McElwain has said that there was a large crowd that attended it, so obviously the issue was a burning issue within the Newton Stewart community. If a large crowd attended there, and he went on then to state that the meeting wasn't very constructive because it kind of deteriorated into a shouting match. Could the PSNI officer clarify what was the sentiment of the meeting? And I mean, in terms of, was the shouting match in terms of opposing views on the issue, or was the sentiment of the meeting dissatisfaction or anger at the issue of the Abercorn Arms and the alleged behaviour arising around it? Thank you, Chair.
Rory, I'll respond to that. The first issue you raised there was why Sergeant McElwain is not present. There are a number of officers from Strabane currently off work due to COVID-related issues, and I'm not sure whether that includes Sergeant McElwain or not, but he has not been at work for the last number of days. I have tried to contact him today because I felt, yes, he would may have been in a better position to answer regards of the antisocial behaviour matters, or I can answer matters in relation to licensing. But unfortunately, I was unable to get him today. But if the committee feels that we're better asking him the questions, I'm sure if this was adjourned for a period of time, I'm sure Davy will be very, very happy to come along and answer any questions. In relation to your second question, Rory, I can only read what's in front of me. He just felt that the meeting became more of a shouting match. And he said just as a result, NI, Northern Housing Executive, just reviewed their practice of using the premises for accommodation for a period of time after that, but did return to start making use of the premises shortly afterwards. I can't really shed any further light on the meeting or the feeling of the meeting or the reasons for the meeting called. I'm sorry, I can't answer that. Sure, thank you.
Paul, for that.
Chair, just a follow-up comment. I think the answer from Paul there kind of backs up my comments around, Sergeant McElwain not being here, in the sense that, a question I've asked, Paul has said, well, Sergeant McElwain would probably be best placed to answer that, So it's unfortunate that he's not here, although I totally accept what Officer Larkin's saying there. I'm sure there's a genuine reason why or Officer McElwain can't be here, but it's unfortunate that he isn't, because it limits the scope of certainly the questions that I wanted to ask in relation to the statement. Thank you.
Darn, Jacqueline, can I speak?
No, I'm just. No, I have a list here. Sorry, Jacqueline, I have a list to go through here. Councillor Edwards.
Sure, thanks for letting me in. And Paul, thanks for your update and report there. And I would share Councillor McHugh's concern there. And I know you're the licensing officer in the PSNI, but it would be good in future meetings anyway to have the neighbourhood team maybe in these meetings as well, to give that sort of local context. Paul, just want to ask there, you said there was a number of reports there. There in your report, there's a number of them. They're one-liners, but I would like to. Is there any of them that refers to antisocial behaviour, and especially is there any that refers to antisocial behaviour after July 2020, when the relationship between Abercorn Arms and the Housing Executive came to an end? Thank you, Chair. Thank you.
Thank you, Councillor Edwards. Paul, if you want to come in there.
Yeah, Stephen, going again what's in front of me. Since July of 2020, the only instance that I've got in front of me is that there was a licensed premises checked in relation to, there was an allegation made of early opening. Police checked that. That was in August 2020. There was no further police action as a result of that inspection. There was a COVID check, like I said, the 20th of August, which I previously mentioned. and a further report on the 14th of December. There was also a concern for safety report made following a story in one of the Sunday papers. Those are the only 4 incidents that police have attended since July 2020, certainly up until the 14th of December 2020. Whilst in the last few minutes, I've been checking some of our systems here, and I can't see any further calls that police have had reason to call to the bar since December 2020. I hope that answers that, Stephen.
Yeah.
Thank you.
Can I come back in there, Chair? Is that okay?
Yeah.
And
Okay.
and just in relation to the other ones before that date, Paul, is antisocial behaviour mentioned in there, and has there been any action taken by the PSNI even before that, like under 2019? Or I'm just wondering, could you give an update there?
Yes, I'm actually trying to get through it all here. The antisocial behaviour, as you're well aware, it covers a multitude of sins. I'm actually, the last one actually where he has actually quoted antisocial behaviour was on the 2nd of December 2019, which was an allegation which occurred inside the bar. And there was a previous incident on the 15th of November 2019 for antisocial behaviour in the bar, and persons were removed from the premises. And then we go back further. There's lots of individual incidents which probably wouldn't fall into the scope of antisocial behaviour. There are breaches of bails and other associated reports, but only those ones that I've mentioned actually states antisocial behaviour.
Well, thank you. Alderman Devaney.
Chair, for allowing me back in. And look, I just want to go back to Paul, and it's no disrespect to yourself on this, but would it be possible that the police have visited, and we've heard allegations about an incident last weekend, whether it was at the bar? I'm not making any allegations, I don't know about it, but it would be possible, Paul, that there could have been visits there and you may not be aware of them.
Morris, yeah, I think it's quite possible, yes. But I'm checking some of our systems at the moment, and I'm unable to see any instances where police were called through the Abercorn Arms. Certainly this one I'm looking at, the last one was actually according to July 2020. But there is a possibility, and there's other systems I would need to check, but there's nothing major shouting out at me here on what information I have in front of me. So at the moment, according to my records, no, there's been no further incidents that we've been called in the last week. But I'll keep checking here as we're chatting, Morris, and hopefully get back to you on that one. Thank you.
Thank you for that.
Okay, thank you. Councillor Ferguson.
Thank you, Chair. Just a quick one, Paul. I know on your statement you'd stated that the community police had thought it was down to the accommodation and the people staying in accommodation. Do you know if there's any incidents reported? And I'm not too over the detail on when the emergency accommodation started, but was there any reports of antisocial behaviour or community upset before it became emergency accommodation? Thank you.
Rachel, I can only speak from my experience with licensing, and I can check all my records here in front of me, and I took over licensing, I think, in 2011. The type of reports that we would have had at that time before it was used as emergency accommodation was very much what you would expect with nearly any bar. You do get instances of antisocial behaviour, but that happens outside many bars. It doesn't. It's not specifically to blame one bar, but no, nothing I would see out of the ordinary with any other bar prior to the housing accommodation being implemented.
Thank you, Paul.
I think, Michael, are you looking in there?
Thank you.
Michael?
I think, Councillor Larkin, if I could just say that in general, from all the information that you've given to the committee and all the answers that you've given to questions raised. Is it fair to say that really from the evidence that you have that there are no breaches of the licensing legislation that would give rise on the part of the PSNI to the continuation of the entertainment license to this premises?
Yes, Michael. Yes, as the licensing officer, there are no instances where I am conducting any investigation into the premises.
That's fine. Yeah, that's all I wanted to ask. Thank you very much, Constable Larkin. That's very much appreciated. Thank you.
Okay, thank you, Michael. And I've no other indicated speakers. So just myself, Paul, can you confirm the allegation or the accusations that Jeanette came out with? Are they have they been recorded?
Yes, I have a number of incidents that that we can check up on, but a lot of these incidents, once they're reported and once they're responded to, sometimes there's a different outcome or what's initially reported. And like I said, I went down. I mean, there's quite an extensive list here, and I don't want to go into much details. I can't. We have allegations of assault in the bar. There was quite a number of breaches of bail incidents regarding, because some of the residents using housing accommodation would be tagged,
Yeah.
I presume, and therefore there'd be a number of incidents of that. There was also one or two incidents of theft. Again, some things that you would see in a normal popular public house, where you would get allegations of theft as well, and allegations of assault. There's also a number of concerns for safety for some of those people as well, living on the premises. I'm looking also there's a couple of warrants as well that police went to serve. So there's quite a broad-ranging scope there in that. But if you were to take the alcohol or the licensing bits out of that, you would only be left with a very handful of incidents regarding licensing. But the majority of those cases are all just really dealing with the people who are availing of the emergency housing.
Yeah. So would it be safe to say that the most of the incidents were caused by people availing of the residence rather than being just in the bar for a sociable drink?
Yes, so that would be my impression of what I have here, and my knowledge with working with the bar. Like, I have been in the bar myself quite in the last 12 months and had a meeting with the licensee. I'm just actually there was one incident I know there was Jacqueline had mentioned underage. There was an allegation of that a time back, and police did attend, and there was a 16-year-old on the premises, actually in the back area playing pool. There was no alcohol being consumed in that area, and police spoke with the parents, and it was certainly a case of just young ones in playing pool, just to give them somewhere to go to. And police were absolutely satisfied that they were not exposed to taking alcohol or somebody even buying alcohol for them, and that was not the case. And like I said, the parents of those kids were spoken to. Most of them were over 18, but there was one 16-year-old, I'm led to believe, and the parents were involved, and police didn't feel there was any further need to pursue that matter. Thank you, Chair.
Okay, thank you, Paul, for that. I don't know indicated speakers. Rachel, I had let you in, hadn't I? You already spoke here?
You did, yeah, Darren, thanks.
So thank you, Paul, for that there. So I'll move on. Paul Rafferty, if you would like to come on there now. Do you see anything you would like to ask questions on, or are you happy enough at that stage?
Yeah, no, I have nothing more to add at this stage, Darren. Thank you.
Now I must, if any of the parties would like to summarise their views at this stage and reverse order, is there anybody who would like to speak? Michael?
Yes, if I could just summarise, we've obviously had a very lengthy hearing in respect of the grant or otherwise of the entertainment licence here from Mrs. Robinson, and everybody has made their points very well. Ms. McGonigal, I again say, is more than entitled to bring the objection for the determination of the committee here today, but I think in the round, and I place a lot of emphasis on Constable Larkin's intimation and indeed the concessions made generally, that we have a situation here whereby my client is a licensee in excess of 2 decades. There are no breaches of the licensing legislation, and Constable Larkin made a comment as well, which is very pertinent, that any behaviour on this particular licensed premises you could not differentiate from any other bar. So really, when you have a bar, you have alcohol served, and I know very well that that gives rise on occasions to intervention by police. But what we're dealing with here today is the suitability of the applicant as a proper holder of the entertainment's licence. And I think if there's any cogent evidence that put forward, then that would give rise to concern for the committee. But I think in the main, we can be confident that there are no breaches of the licensing legislation or indeed the relevant order, which would give rise to concern and lead to the revocation of that licence. And I think the proof is in the pudding, and I have already said, and indeed I think Councillor Hussey as well maybe honed in on it, that if the committee feels that they need an additional requirement of the cessation or an undertaking from the applicant, that the contractual arrangement with the executive is at an end, which we have stated very firmly it is at an end and has been at an end for some 15 months. We have no difficulty with regard to that. I'm not overly happy with regard to it, but if it is something that allows my client, the applicant, to continue operating her licensed premises as best as she can in the current climate, then we've no issues with regard to that. And if that assuages any concerns of the committee, then so be it. There will be no issue with regard to that. And Constable Larkin, being the licensing officer, has already conceded that there have been divers occasions to attend on the licensed premises, and ultimately, when the matters have been looked at and investigated, they have not given rise to any concern with regard to the subject matter here today. So I have nothing further to add other than the submissions which I've made now. Thank you very much.
Okay, thank you, Michael, for that there. Jeanette, if you would like to sum up there, you're more than welcome to.
Yes, Chair, thank you. Can I just say, this is to Mr. Fahy here. I just want to say, how well do you know your client? Because I know her pretty well. And I am in the town here on a day-to-day basis. I both know what is happening on the ground here. I work every day on the ground here. And I have good relations with the people here in Newton Stewart. And everything that I have said as the truth on the story and on the matter. Thank you, Chair.
Thank you, Jeanette, for that there. Paul, you're probably okay, or do you want to sum up on anything? Are you okay?